Hello, my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, May 17th, and it is time for an IC support group meeting. Now, the purpose of my meetings is to make you so strong, so knowledgeable, and so informed that no one can ever mess with you again, right? Be right back. Hello, Facebook. I will be right back. Give me one quick sec. Oh, hello, my friends. Hello. Hello, Shannon from California. I am also in California. Okay, so like it's totally stormy and weird out there. The lights are all weird. My face looks all weird, but it is what it is. This is what you're getting today. If I can switch this color, hold on. Oh, there's a little bit of color. All right. Hello, Michelle from Maryland. I hope that life is treating you well. Hello, Donna. Nice to see you. My smile is crooked. I don't know why. Weird. That's because I had a pimple and I got all swollen down there. It's still recovering. Hello, Deb from Canada. It's nice to see you. All right, now I'm totally messed things up. Hold on. Feels right. That's how my makeup feels today. It does not feel right at all. But anyway, you know what? Listen, thankfully, we don't have to wear makeup for our bladders. Y'all can be right at home in the comfort of your pajamas and your yoga wear. The great thing about an online support group meeting is you can get up whenever you need to go to the bathroom. Hey, how cool is that? Right? So if you got to get up every 10 to 15 minutes is okay. But our goal here is to try to figure out why you're getting up every 10 to 15 minutes and fix it, right? Hello, Kirsten. Hello, Julie. Kirsten says hello from Florida. First time in this group, but I've had IC for as long time as I can remember. Well, Kirsten, welcome. Hello, Ivana from Indiana. Hi, Deborah from Wisconsin. Shannon says I had my bladder Botox on Thursday. The most painful thing ever. What? You should have been asleep for that. They didn't do that when you were awake, did they? Or are you saying you had pain when you woke up? Hello, Lauren. Hello, Nancy from Missouri. Nice to see you. Deb from Canada. I think I already said hello to you, but hello again, just in case I didn't. Oh, what a world we live in. Right. So, hello, John. It's nice to see you. Shannon, I'm very curious as to why you were in pain. That doesn't make sense to me. I mean, you shouldn't have had that procedure awake. That's for sure. So are you saying that you had pain from your Botox when you woke up? Hello, Mary. Howdy, right back to you. Kirsten says, what other treatments are available besides hydrodistension? Well, Kirsten, what? Wait, what? You had your Botox when you were awake? Normally it's done during a hydrodistension as an outpatient procedure and you're asleep. How did they numb you from the inside? Would they do a lidocaine installation? Lauren, that's a great question. We're going to come back to that. Wait, okay. So, guys, listen, this is really, really important here because here's Shannon who had a test that was should normally be done in the operating room, or a procedure normally done in the operating room. And she had it done at the doctor's office without anesthesia. She had Botox. Shannon, have you had it done that way before? And are you saying that did it hurt when he was putting the needles in? Megan says her IC is triggered by mold. Absolutely true. We now know if you have black mold in your home, that will cause urinary frequency urgency. But so, you know, one of the things that we're always grappling with in the IC world is the fact that, well, and you know what, Shannon, we gotta be crystal clear here. We're dealing with COVID. And, in fact, I just wrote a couple of big articles on it. I actually attended a class that was done by the European Association of Urology last week that talked about how COVID is affecting female urology and functional urology. And this is what we know. Obviously, around the world, non-essential urology appointments, exams, treatments, etc., canceled. And when we look at the totem pole of priorities, benign conditions are the lowest in the totem pole. So obviously, the first thing they're going to take care of is somebody who has a traumatic injury, somebody who has an obstruction, somebody who is bleeding profusely. They're going to get priority in any urology clinic and any OR. And then we go a step below that, and that's when they're going to start looking at urinary retention and things about this. Kind of things in that category, maybe kidney stones that are blocked and causing discomfort, potentially if they're not responding to traditional therapy. Anyway, there's this 5-point scale that at least they're using in Europe to prioritize. But one of the things that most communities are doing is that they're creating a hot hospital and a cold hospital. So the hot facility is the hot facility that's treating COVID. The cold facility is absolutely not treating COVID. So now, when you are going to have a procedure and you've got to be in the OR, you should ask, am I going to a hot facility or a cold facility? And in the big zones where there's a lot of COVID, especially now in the Midwest, still in New York, um, they're keeping that line, right? And so some procedures that would normally be done in a hospital, unfortunately, that's a hot hospital, they're now moving to outpatient procedures and maybe even doctor's offices. And so, Shannon, maybe that's why you had it done in your doctor's office. I mean, that's a possibility. Maybe, just maybe, they felt, oh, whoa, hold on. Shut the front door. Holy hell, we got a problem in this room. Julie McKenzie, your doctor does silver nitrate installations? No, 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 no. No, 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 no. Silver nitrate is no longer done for IC. It is not even mentioned in the AUA guidelines as a treatment for IC. And you want to talk pain? Seriously, if you thought that Botox hurt, Julie, silver nitrate installations can be devastating. And so I wrote a blog on it because it's come up several times at various conferences. Man, that's a treatment from the 40s and the 50s. That is not a treatment for interstitial cystitis. That is not a treatment for a bladder injury. That goes back to the old days where they thought that if you strip the bladder lining off, a whole healthy bladder lining might grow, or maybe they're thinking the silver nitrate might kill quote unquote infection, which it does not necessarily do. So Julie, I wrote a editorial about this a couple years ago, and it was something like a bladder rape by silver nitrate. That is not a therapy. And if your doctor says he wants to do silver nitrate, I would run. But honestly, what I would say is this is not a therapy for IC as designated by the American Urology Association. As a result, why? And the reason why it's not is because it's never been found helpful in any major research study for IC. It is specifically excluded as a treatment for interstitial cystitis. Excluded. So please, 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 please do not Now, listen, I'm not a doctor. I am not supposed to give you medical advice. It is never my intention to give you medical advice. I will tell you, I don't know a single national doctor who would do silver nitrate anymore. Man, that's the dark ages. And I want to see if I can find, uh, we had I think I can, let's see, hold on. Let me just see if I can find it here. I would also ask that doctor, why he's using something that's not authorized by the or approved by the American Urology Association. Yeah, so if you just Google bladder rape by silver nitrate, I did it April 7th, 2014. Let me just read this, guys, because this is really important. I don't want you to walk into a doctor's office and say, hey, and not be involved in the decision making here. If a doctor wants to do an installation, you got to ask, what is that installation? What are you proposing to use in me? And you can't just say, hey, I use it all the time. It helps my IC patients, yada, yada, yada. Man, you got to get specific. Is it chlorpactin? Is it silver nitrate? Is it a heparin installation? Is it a lidocaine installation? Is it a DMSO installation? There are lots of different installations. You got to start writing this stuff down. What kind of installation are they doing? So let me just read this. And actually, I also need to introduce myself. I am Jill Osborne, president and founder of the Interstitial Cystitis Network, not association. Oh my God, no, network. I'm the longest serving IC support group leader. I've been a support group leader for 27 years. I sat on the US Army IC research panel for a decade. We do our own research ourselves. We are rated #1 in the world by University of London and Harvard Medical School for our website, which you can find there, icnetwork.org. The purpose of my doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again and give you a silver nitrate treatment. Like, holy hell, mother of God, no, no, no. I'm going to read this. There is no excuse for what happened to a female patient this year. Guys, remember 2014. Her primary care provider suspected she had interstitial cystitis and referred her to a urologist in her community. She made an appointment and met initially with a urologist nurse practitioner who asked the patient if she could get a, quote, clean catch urine sample using a catheter. What happened next is the closest example I've encountered to the rape of an IC patient by a medical care provider. Without informing the patient, the nurse took the urine sample and then filled the patient's bladder with silver nitrate, an old, outdated therapy that is not recommended for interstitial cystitis in the AUA guidelines. The pain of the solution in her bladder had the patient screaming at the nurse, asking her what she did, and then begging that it be drained immediately from her bladder. The nurse refused and kept it in her bladder for 5 minutes. Silver nitrate and chlorpactin were last used for IC more than a decade ago. They harken back to the days when caustic bladder wall stripping treatments were used to destroy any potential bacteria and encourage the growth of a new bladder lining. No longer in use, neither silver nitrate nor chlorpactin are mentioned in the AUA guidelines as a treatment for IC, and in our experience are only used by clinics with providers who are older and not familiar with the new approaches to treating IC. And here's a quote. This is a quote from Rob Moldwin, one of the top IC doctors in the world and the author of the IC Survival Guide. He says, the concern about using these medications is their tendency to cause scarring and even stimulate the growth of more nerves at a later date. These medications are therefore not generally used. The downsides of this old school treatment are numerous. Agonizingly painful, they usually require anesthesia to administer. In the IC Survival Guide, Rob Molden wrote, they cause a great deal of damage to the bladder surface and destroy the nerves of the bladder. He shared, quote, the concern about using these medications is their tendency to cause scarring and even stimulate the growth of more nerves at a later date. These medications are therefore not generally used. In 2014, first line or step one therapies are designed to be calming and soothing to the bladder and pelvic floor by using diet modification, pelvic floor muscle relaxation, and so forth. Silver nitrate is so caustic that, as Dr. Muldern explained, a test called a cystogram must be performed prior to the installation to ensure that no fluid can move up to the ureters and up through the ureters into the kidneys. Silver nitrate can damage and potentially block the ureters with scar tissue. Thus, ureters which allow reflux must be blocked prior to treatment. Neither anesthesia nor a CMG was offered to this patient. When she asked the nurse why she placed silver nitrate in her bladder, the nurse said, "That's what we do for all patients who come into our office with your symptoms. It usually doesn't cause the pain that you experience." I find this shocking and absolutely unacceptable. Silver nitrate is notorious for causing severe pain. Why it would be administered during a first appointment when the patient was just looking for a diagnostic information and had yet to speak to a urologist is a question worth asking. Why, as well, is this clinic not following the AUA diagnostic protocol, which talks specifically about reducing both physical and emotional trauma to the patient? I call this bladder rape for a reason. This patient, and perhaps countless others in that practice, was given this painful, damaging therapy without her knowledge or consent. This patient then asked that the treatment be drained from her bladder. The nurse practitioner refused, and the patient was forced to keep it inside her for 5 minutes. This patient endured agonizing pain for weeks afterwards. She is now afraid of receiving a urologist care. This is absolutely inexcusable in 2014. I encouraged her to deliver a copy of the AUA guidelines to the office and to ask for an explanation as to why she was given a therapy without her consent. In my humble opinion, a complaint to the state medical board and or the nursing board is justified. There is simply no excuse for administering this therapy if administering a therapy as damaging as this without consent, nor for following the AUA diagnostic treatment guidelines. Worse, if I have to wonder if this would qualify as criminal assault. Okay. So, guys, seriously, don't let anybody put anything in your bladder without telling you what it is, telling you how it's supposed to work. And then, more importantly, you should have done your work ahead of time by reading the AUA guidelines in our website so you know what's acceptable. Chuck says, why are more males getting IC? Remember, Chuck, we don't think of IC as an incurable bladder disease anymore. We think of it as a pelvic pain syndrome. Chronic prostatitis / chronic pelvic pain syndrome affects millions of men. We now think that IC and chronic prostatitis, chronic pelvic pain syndrome are very similar, which is why they're both called a urologic chronic pelvic pain syndrome, which is why the National Institutes of Health is studying them together in research studies. Oh boy, I'm going to be talking a lot today, so I'm going to have to be drinking water. I am charged up. That pisses me off. It pisses me off that a patient is being given an old medication, which is no longer considered a therapy for IC, that is damaging to tissue. And I am so sorry that that is happening to you. And I would honestly find another doctor. That is disgraceful, in my opinion. All right. So somebody else just asked about therapies. Now, listen, guys, we cannot have a good discussion about treatments without first understanding what your unique subtype is, right? Because a one treatment fits all approach does not work. It doesn't work, period. Elmeron doesn't work for the vast majority of patients who try it. Why? Because we're all different. Now, listen, for some people, IC begins in childhood. For others, IC begins after menopause. Are they the same? Oh, hell no, they're not the same. For some people, IC begins after chemotherapy. For others, IC begins after falling on their tailbone. Are they the same? Absolutely not. And, you know, when you consider the symptoms of IC, it couldn't be more clear that we're different, because some patients have agonizing pain, others have no pain. They just have mild frequency urgency. Some patients have bleeding, bloody ulcers on their bladder, or lesions on their bladder. Others, like myself, our bladder is perfectly normal. You look at my bladder, it is a baby bladder. It looks great. Yet there's no doubt that I'm an IC patient. So, what doctors have been doing now for the last decade at these elite top levels, I mean, I'm talking the top 100 doctors in the world, they're kind of in this contest to try to define the unique variations of IC, because we can't give you the right treatment until we know what your unique variant of IC is. So they're working on phenotyping or subtyping. They're trying to define all these unique variants of IC. So in Europe, there's 16 variants of, well, 12, potentially 16 variants of IC, depending upon your biopsy results. And they're all treated fairly differently. In Canada, they use a different system. They use a system called UPoint, which focuses on 6 variants. In the United States, we don't have an agreed upon national system. However, I use a system that was created by Dr. Christopher Payne, who ran the IC research program at Stanford for 25 years and chaired several federal IC meetings for the National Institutes of Health. Here, hold on. I got to fix my computer here. It's being weird. All right. Okay. All right. So in his system, he introduced his system really provocatively. I thought it was quite shocking the way he introduced his system, because he said we should treat IC patients like cancer patients. And in my brain, I'm going, oh, holy hell, why would you say cancer and scare patients? And his response to that is, no, think about it. When you're diagnosed with cancer, you're given a very specific diagnosis. Like for me, 3 years ago, I had complex endometrial hyperplasia with atypia and a vague architectural complex. What does that mean? That was early uterine cancer. It was such a specific diagnosis. We knew exactly what to do next to save my life, which was, in fact, a hysterectomy. If you've got, they don't just tell you you've got cancer and send you out of the office. They've got, hey, you've got cancer of the left breast. It is estrogen dependent, type 1, 2, 3. And the purpose of that specific cancer diagnosis is so that both you and your doctor know what to do next. It gives you a very clear treatment pathway. And he argues very successfully that a diagnosis of IC does not give you a clean treatment pathway. You get the diagnosis, hey, you've got IC, but you don't know what to do next. And in many cases, your doctor doesn't know what to do next. So how do we give you an intuitive treatment pathway? We do it with specificity. We give you a more specific diagnosis. And so Dr. Chris Payne proposed 5 variants for IC. Variant number 1, Hunner's lesions. And this is something everybody in the world agrees on. In fact, there was just another research study that was presented, I think in the American Urology Association poster sessions for this year's conference, which of course has been canceled. But anyway, we can see all that research. Everybody agrees that a patient with Hunner's lesions or Hunner's ulcer should be in its own unique group. Why? Because you're completely different. When they biopsy a lesion, it is filled with inflammation, massive inflammation. As a result, we know that a very aggressive fight is happening in the bladder wall in the center of those lesions. And I've got pictures. And I'm going to get to the infection thing. Don't worry about it. I'm going to get to the infection thing. It comes up all the time now. All right. So let's look at, these are pictures of Hunner's lesions. Now, this is only 5 to 10% of the patient population. So look at this lesion right here. It's known for having a stellate appearance, which means it's kind of star-like. There's a dark center with lines that emerge from this. So you can kind of see that. This one is kind of half-sided, but you can see the big red lines that come from it. This is a separate process. So now there's a very compelling argument that all of these patients should be split off into their own unique disease. And in Europe, it's only patients with Hunner's lesions who are diagnosed with interstitial cystitis. And that's becoming true around the country. and around the world in other countries. Everybody else, all the other subtypes, we are more of a pelvic pain syndrome or a bladder pain syndrome. Now, we know that when we look at the history of IC therapy research, like Elavil, Elmeron, imipramine, uh, uh, Vistaril, Atarax, hydroxyzine, all of those early studies, DMSO, nothing really worked well. I mean, the results in that study, in almost all the studies were really poor. Why? Because you had a heterogeneous group of patients, including these patients. And the thing is if you've got Hunner's lesions only respond to Hunner's lesions unique therapy. They have to treat the lesion. Elmeron does not work for a Hunner's lesion. A supplement doesn't work for a Hunner's lesion. What works for a Hunner's lesion is lasering the center of it, cauterizing it, maybe doing a steroid injection into the middle of the lesion. And of course, somebody with Hunner's lesions, man, your diet's going to be really limited while you got an open lesion, because when urine hits that lesion, it's going to hurt like hell. And so it's going to be very, very, very important that you follow the IC diet until your lesions are treated correctly. Now, the cool thing is that when you treat a lesion correctly, the pain usually goes away, which is great. I mean, 85% of patients report that their symptoms improve dramatically, especially their pain, when their lesion is treated. And so getting these lesions treated is important. I think that one of the saddest things that happens in the IC movement is the patients who have a hydrodistension and they see a lesion and they do nothing. And it's a tremendous lost opportunity. If you're going to have a hydrodistension, you're always going to ask that doctor, what are you going to do when you find a lesion? If he says nothing, you're going to say, then I don't want to do this right now. I want to be treated correctly. Are you capable of treating what you find? Will you laser it? Will you do a steroid injection in it? And I will say in our office, easily, I'm going to say 75% of the people that I work with that are crying in pain have untreated Hunner's lesions. Okay, so that's IC subtype 1. IC subtype 2 is bladder wall injury. Bladder wall injury, because hello, my friends, the bladder, like any other part of the body, can be hurt. How is it hurt? Usually it's hurt with a chemical. So this is an example of a bladder wall injury, right? This is what bladder wall injury looks like. So this is the chemotherapy patient. This is the Mountain Dew or Diet Coke patient. I was working with a patient on Friday who basically been drinking Diet Coke for decades, and her bladder was toast. You know, your bladder simply cannot tolerate intense acids over long periods of time. Remember, our bodies were built hundreds of thousands of years ago, and we didn't have even 5,000 years ago acid in our daily environment. Our body is not built to tolerate massive levels of acid, unless perhaps you're from around the equator where you might have had fruit year round. But if you're like me from Norway or Sweden, you can damn well bet the only acid we ever had was unripe apples or unripe berries once a year when they were in season. So we can argue successfully that perhaps my body does not have good defenses for bladder. And I think that that's very, very true. So we know chemical injury can cause this. We know that estrogen atrophy, if you're menopausal. Unfortunately, when you're menopausal, you start losing an important thing. Here, hold on. So let's look at a picture of a three-dimensional picture of what your bladder wall looks like. You've got an outer coating of mucus. You've got an inner coating. Well, it's not. You've got a layer of urothelial cells, which makes up the actual tissue of your bladder wall. And then underneath that, you've got nerves and you've got blood vessels and you've got mast cells. So unfortunately, this blue layer, although it's not blue in your body, you know, your bladder basically looks like your mouth. It's a hollow organ covered with mucus. that mucus is estrogen dependent. So when you're young and you've got lots of mucus, lots of estrogen, you got lots of mucus. When you're older and you have less estrogen, guess what? You have much less mucus. And so what that means is that the irritants in urine are now getting through your mucosal barrier where they're causing irritation here. That is called estrogen atrophy or the genitourinary syndrome of menopause. So if you're in your 40s or older, ladies, it's going to happen if it's not already happening. Be prepared. The quality and health of your skin is something you've got to pay attention to. If your vulva is dry, if your vagina is dry, then so is your urethra and so is your bladder. Now, for both of these, the chemo injury, the chemical injury, as well as for estrogen atrophy, the logical therapy is going to be something that has a coating effect. And that's where Elmeron popular was more successful because Elmeron, in fact, an old Elmeron postcard. And you can see what they said is that the Elmeron kind of coated your bladder. Of course, now we know that Elmeron is linked with retinal disease, pretty severe retinal disease. So Elmeron is not very popular. But what a lot of patients are doing instead they're doing a supplement that contains chondroitin. We had a research study released at the European Society for the Study of Bladder Pain earlier this year, which showed that chondroitin helped to restore the surface integrity of these cells. It helped to restore the strength of these cells. So again, for this patient, our therapeutic priority is to provide some extra protection and coating on top of your bladder while your bladder is healing. Or if you have estrogen atrophy, to give you a little extra oomph in there, right? A little extra coating in there. So most patients start with supplements that contain chondroitin, and they are so the top supplements that are used in the IC world are going to be Bladder Builder, or Bladder Rest, or Cystoprotect, or Cysto Renew. These are the top chondroitin-based supplements. And some people find that aloe, and the company that we recommend is Desert Harvest Aloe because they're the ones who specifically done IC research. Some people find aloe to be calming and soothing to the bladder wall. Now, there is one other variant of this, well, there are probably a couple more subtypes to bladder wall injury. We have to consider the role of chronic infection. Some patients have chronic fungal infections like candida infections. And we know that from our own research at the US National Institutes of Health. And there was just another study. I was just reading another microbiome study about the bladder and comparing patients with IC. I think it was patients with IC and prostatitis this time. Anyway, while it's logical because the symptoms that we have are associated with infection, many patients they guess or they assume that they've got a bacterial infection. But what we now have multiple research studies showing it's not a bacterial infection, it's a fungal infection. That many IC patients who are flaring have an overgrowth of candida. And again, last week, there was a really interesting patient that I was working with. She always flared when she ate sugar or she ate carbs. Why? Because candida eat those. Think about if you're making yeast bread. What do? You put yeast in warm water with some sugar, and what happens? It bubbles. It grows. Fungus need carbs and sugar to feed. And that's exactly why she was flaring when she ate sugar. She had an overgrowth of candida. Now, We also have to consider viral infections. We absolutely know that certain viruses can be found in the bladder wall. The polyoma BK virus, the Epstein-Barr. So we're seeing the influence of viruses. I can tell you that COVID, they have found COVID in the bowel and bowel movements. They did not find COVID in urine, but they did find COVID in sperm. So remember that viruses can be affecting your bladder. And of course, yes, some people can have embedded bacterial infections. The challenge with this, the challenge with this is identifying it. Now, there is a Dr. James Malone Lee in England who does not believe that any of the testing is valid, that it's not specific enough, that there's no way to prove which quote unquote bacteria is triggering that patient's symptoms. So he kind of guesses in a way. He assumes that there's infection and he provides antibiotic therapy. The problem with that is that antibiotic resistant infections are flourishing around the world. And we're trying to prevent that by not overusing antibiotics. It's called antibiotic stewardship. So there are very, very, very few doctors who, at least here in the United States, who would actually recommend that protocol. Instead, what they would do is they would say, let's see if we can find it first and do a next generation urine test and see if we can identify a pathogen. The cool thing about next generation urine testing, and you can go to bladderhealth.org and learn more about it, is that this looks for DNA and RNA. It looks for genes, right? DNA or RNA, right? And it compares what it finds to big national databases, and it looks for antibiotic resistance genes. It will identify everything living in your bladder: good bacteria, bad bacteria, fungus, and if you have the viral test, it will also identify viruses. And so most doctors, especially infectious disease specialists, would start with that test to see what they could identify, see if there are any antibiotic genes present, and then go from there. So if you're interested in that, go to bladderhealth.org, and you can watch a bunch of videos that were filmed with doctors who use this very, very successfully. The challenge is that a lot of local doctors and a lot of local HMOs are not familiar with it, or it's not approved and it's not on their list of qualifying tests, and so they will poo-poo it. But that said, at the infectious disease level, or if you look at all the COVID testing is next generation testing. And in fact, the company that does this, Microgen, is now doing a ton of COVID testing. Okay. So that's IC subtype 2. So we're talking about chemical irritation, we're talking about estrogen atrophy, and we're talking potentially about chronic infection. IC subtype 3 is muscle injury. So these are the patients whose symptoms have started after falling on their tailbone or a traumatic injury to their pelvis. If they were bike riders, dancers, they fell off of a horse, if they sit for long periods of time, if they had a baby and suffered a traumatic tear to a muscle down there, that's muscle. And here's the challenge: if your urinary diaphragm muscles are tight, they're going to give you frequency, urgency. They're going to give you all the symptoms that you associate with your bladder. So these are generally the patients whose bladders look normal, but they still have symptoms. And when we look at those muscles, that's where we find the issue. We find tight, dysfunctional muscles. Here, hold on a sec. No, that's not good. I'm sorry, guys. We have lots of clouds. The light keeps changing. It's windy here in California. We've had lots and lots of rain in the last 24 hours. IC subtype 4 is a nerve injury, pudendal neuralgia. So these are the patients whose symptoms are nerve driven. So it's electrical pain, it's a burning pain, it's a searing pain. You're worse when you sit, you're fine when you stand, but the symptoms get really, really profound when you bend over or squat down. And that generally means that you've got a muscle, your pudendal nerve, that is under pressure. I mean, you've got a nerve that's under pressure from a muscle. And when you bend in a certain position, you're stressing that nerve, and that's triggering that symptom. And so for these patients, our therapeutic priority is to calm and soothe the nerve and try to figure out what is pressing on that nerve. And generally, that's usually a tight, dysfunctional pelvic floor muscle. And the last subtype is central sensitization. This is the inherited subtype. These are the patients who have um, exquisitely sensitive skin. This is my subtype. My mother has IC. My sister has IC. My grandmother, my aunt, my cousin. This goes back throughout our family. And it's characterized by having a really, really sensitive nervous system. So we've got really sensitive skin. We have a wicked sense of smell. We can smell things that other people cannot smell. And I remember my first year with IC as a support group leader, that was something that a researcher at UC Berkeley was working on, is why do so many IC patients have a wicked sense of smell? Because smell is the brain function. Like, well, that doesn't make sense. Why would a bladder disease cause a change in smell? But now we know why. Now we know why, because for many of us, we may have inherited a more sensitive nervous system. 5,000 years ago, it was the sensitive person in the tribe who could smell the good water versus the bad water, the good food versus the bad food. Sensitivity is not a disease. It's just the gift of our ancestors. And sometimes it happens after a major injury. So if you have a wicked sense of smell, if you're chemically sensitive, if you're food sensitive, if you're drug sensitive, for me, mine manifests as pinpricks. I would just get random pinpricks throughout my body. And interestingly, and it's gotten worse as I've gotten older. The first thing that actually has stopped that for me is Peora, which is the supplement that I take to calm my nerves down. So our therapeutic priority for somebody with central sensitization is to calm the nerves. And the odds are you're probably already doing that. The odds are you're not using chemicals in your home. The odds are you're probably happier in a rural environment or a suburban environment rather than a big city because of all the smells. It's like you're being sensory overloaded when you got central sensitization. And so from a daily basis for us, our goal is to keep our body calm and soothed, and our nerves calmed and soothed. So we're the ones who've got to pay extra attention to stress. We've got to really work on our stress management skills. So my subtype is IC subtype 5, central sensitization. That's the landscape. That's my biology. I get it. I don't need to treat it. It's my job to protect my nervous system. And then my second subtype is pelvic floor driven, because I have piriformis syndrome, SI dysfunction. My bladder is perfectly healthy, and yet I can have symptoms of frequency, urgency when I mess up my muscles. So when we're talking about treatments, it's not helpful to just say, does Elmeron work? What we have to do is say, what's your subtype first? We have to figure out your subtype to really find the right treatment. And what the American Urology Association guidelines say is, hey, man, listen, if you're not responding to bladder therapy, take a step back. It's like, wait a second, let's do it. Maybe we missed something. Maybe there's something else involved. Maybe you've got a fibroid tumor pushing on your bladder. Maybe you've got a Tarlov cyst. Maybe you've got black mold in your home. Or maybe you've got pelvic floor dysfunction. There are a lot of things that have to be ruled out to establish a diagnosis of IC now. And the good news, as Dr. Payne said in his subtype, he said it is absolutely cruel to tell these patients that IC is an incurable bladder disease, because in some of you it is completely curable, because it might not be a bladder disease. It might be a muscle injury, and we can fix muscle injuries. Okay. All right. Hold on. Let me get a drink. Woo, Betty. Heidi said, bladder builder made me flare. Yeah, Heidi, in some people, the first couple of days, you might feel like your symptoms get a little bit worse before they get better. But if you're somebody who cannot take probiotics, then you're not going to be able to take bladder builder, because bladder builder does have probiotics in it. And so then you really have to try one of the other ones instead. And the cool thing here is that we have an absolute abundance of therapies that we can use now. Gabby said, how do we cure candida? Gabby, the doctor may give you an antifungal like diflucan or nystatin, but ultimately it's about not feeding it. And that means you got to massively reduce carbs, massively reduce sugar, and just create an environment where the candida will not flourish. And that's where, again, antibiotics are challenging, because antibiotics kill the good bacteria that normally keep the fungus in check. So, Chuck, getting back to your question, why are more men getting IC? Actually, that's the wrong question. Why are more men getting injury? That's what you've got to think about. Either it could be a bladder wall injury or pelvic floor injury. But I will tell you that I work with men every week. My support group had more men than women in it when I first started the support group. And that's why I'm particularly interested in men, because I think that in a way, what happens with a guy with frequency, urgency, pressure, pain is normally you're told that you've got prostatitis and you're given antibiotics for years, or Flomax or stuff like that, before a proper diagnostic workup is done. And I will tell you that in my experience working with men, I can almost always find a pelvic trauma in their history. 90% of the time, I can find a pelvic trauma. Lauren says, are you hearing any more information about the Elmeron lawsuits? I have a lawyer. Yes, I do have more information on the Elmeron lawsuits. We have 2 more lawsuits filed. So we have a total of 3 federal lawsuits filed now against Johnson & Johnson, Janssen Pharmaceutica, over the Elmeron issue. And I've got an extensive Q&A from the attorney who filed those lawsuits that is going to be on our website and in our magazine. Our spring magazine is at the typesetter right now. Carrie says, I have IC adenomyosis and Raynaud's. I want to discuss testing for autoimmune. What should I ask my doctor about? Well, so that's one of the other things that gets talked about frequently on the internet, and that is this IC and autoimmune disorder. And in fact, there are some doctors who believe that IC could be an autoimmune disorder. And I agree. I do think that there is a small subtype of patients, a small group of patients who do have an autoimmune disorder. If you've got lupus, Sjogren's, IC, the odds are it is probably autoimmune. But generally, when they do the testing to try to establish IC as an autoimmune disease, it doesn't meet the full criteria as an autoimmune disease. So what you should talk to your doctor about, just say, hey, listen, I've got these other conditions. I would really like to know if I've got an issue. And they might refer you to another doctor to see if you've got an autoimmune issue going on. Hey, you know what? It's really hot now. I got to go get something to put my hair up. I'll be right back. Hold on. Hey, bathroom break. I'll see you in 15 seconds. Because you know what? ICers, we can pee fast. Am I right? We are the fastest peers in the world, unless, of course, you've got tight muscles. Then you've got to sit there for 10, 15, 30 seconds before you can release. Okay, hold on. I'll be right back. Okay. All righty then. By the way, y'all notice IC Strong. IC Strong. This was our T-shirt for our 2019 IC Awareness Month campaign, and we got to talk about IC Awareness Month this year. It's done in September. All right. Woo, that's better. I got to get this off of my neck. We need a slogan for IC Awareness Month this year. Like we stand together, we've used. We need a slogan. And most of all, I want to hire somebody to run it this year. Good money, guys. But we really need to brainstorm. I mean, with COVID and everything, everything's changing this year. We need to, if we're going to have a good IC Awareness Month campaign, we got to come up with something new and different. All right. That was not a hot flash. That's just that I've got lights on. All right. All righty. So, guys, I simulcast on Facebook and YouTube. If I'm looking down here and looking at YouTube, if I'm looking at Facebook, I'm looking right here. So let's go through some of your questions here. Tiffany says, have you ever dealt with uterine prolapse? Do you know anyone with it or have info about it? And we deal with uterine prolapse all the time. All sorts of prolapses all the time. Pelvic floor. Pelvic floor. Your pelvic floor muscles go from left to right, front to back, low to high. The purpose of your pelvic floor muscles is to basically help you move your limbs. You've got your piriformis muscle, which lets you move your leg like this, so the muscles are involved in how your body is moving, but the muscles are also stabilizing your organs. They're stabilizing the position of your organs. When you're, here, I use this one. I use this one. The other thing about the pelvic floor. Oh my God, I did it. Okay. Did you see that? I just kicked my chair. Okay, am I too low? Okay, I guess it's okay. All right. Hey man, it's not a support group meeting if something doesn't fall or I don't mess my chair up in some way. Here, hold on. Come on, chair. There we go. Okay. Hey man, we haven't had the earthquake yet. We're going to have an earthquake. I'm telling you, I've had 2 earthquakes so far doing live meetings. We will have one. Okay. So what makes the pelvic floor so unique is it's really the only major muscle group that controls major bodily functions, because it's basically got 3 gaps in it: a gap for your urethra, a gap for your uterus, and a gap for your rectum. And so and that's for a woman. For a man, obviously, you just got 2. If the muscles are tight, it's pretty hard to get stuff through those muscles. So peeing is hard. You've got tight muscles if you can't start your urine stream right away. Or for women, if intimacy or having a doctor put a speculum in your vagina is very, very painful. Okay. And so if your muscles are tight, it's hard to let stuff out and it's hard to let stuff in. If your muscles are loose, so think of this as your bladder or your vagina. If your muscles are weak, what happens? It opens up and things start to fall out. Now, if they catch it early enough, you might be able to use pelvic floor exercises to strengthen those muscles. But if the muscles have stretched out too far, you're looking at surgery to try to fix that, hon. Because I'm going to tell you one thing: when you've got something falling out of you like this, walking is very uncomfortable. What they may do is use a pessary. And with a pessary, what they do is they stick something up into your vagina to keep your uterus where it needs to be. And you might be surprised to know that a lot of professional women athletes have to use pessaries. They will run marathons with pessaries because their workouts have damaged their pelvic floor so badly, so dysfunctional, that the only way they can run or be athletic is when they use a pessary. But Tiffany, you may get to the point where you may need to have surgery instead. All right, hold on a sec. YouTube. Hi, Sherry. I know you came in a while ago, but hi. All right. So let's look at Facebook. Now, you guys with Facebook, um, Facebook doesn't sometimes it lets me scroll back and sometimes it doesn't. Is collagen effective? Not separately. I mean, collagen is on its own is not really considered a therapy for IC. Hold on. Sorry, my shirt's all weird. But it's probably not going to hurt, and that's why they put collagen in bladder builder. All right. Veronica says all of those supplements hurt your bladder. All of them? That's really, really rare. And so Veronica, what I would have to assume in that circumstance is that you probably have Hunner's lesions. You know, anytime you have wounds, and in this case, imagine a wound that goes through here, right down here, and because a Hunner's lesion is a deep wound, right? So that means that your urine and anything in your urine is getting right onto those nerves and right into those blood vessels. And so if that's the case, hon, I think that I would want, if it were me, I would want somebody to look in my bladder to see what's going on. You know, guessing will only get you so far. At some point in time, if you've got blood in your urine, if you've got long-term chronic pain, y'all want eyeballs on the bladder. We got to look at that bladder and see if we've missed anything. You know, I've worked with some patients, a couple of patients, two or three patients now who actually had stitches in their bladder wall from other surgeries. And when the stitch was removed, their bladder symptoms went away. Mary Lasher was one of our winners last week, and she won a bottle of Cysto Protect, and she says she received it 3 days later, Maryland, California. Awesome. Mary, I'm shipping everything priority mail right now. Gary says, I'm one of the few men who have IC. I have an interstim implant on my backside. Cool, Gary. Gary. So, Gary, I would love to know if you're still here, because you said that 23 minutes ago, and I'm always behind on Facebook. I would I ask you to go back to when your symptoms began. Think about when your symptoms began. Was there any event, car accident, fall? Did you go skiing, anything at all like that where you fell? Veronica says, can vaginal estrogen help to heal the bladder? No. What vaginal estrogen will do is it will improve the production of estrogen. I'm sorry, of mucus. Vaginal estrogen will help your body produce more mucus vaginally, and they do believe that the estrogen crosses through the vaginal wall to the bladder to help the bladder also produce more mucus. But there's nothing from the outside that can heal the bladder. The bladder heals on its own. And the thing you got to understand about the bladder is it's the slowest healing organ in the human body. It takes 2 weeks for one cell to be replaced. So many people will do a therapy for a week and then they'll abandon it. And they don't understand that it's physically impossible for the bladder to heal in a week. It takes 2 weeks for one cell to be replaced. And God forbid you drink 1 cup of coffee in that 2 weeks. You've killed that new cell, and now you've got to wait again and again and again and again. So your job, if you're IC subtype 2 and you've got a bladder wall injury, is to create an environment to support healing. That means the diet, lose the coffee, lose the soda for like 3 months. Really give those tissues time to heal. Lisa says, you hit the nail on the head with all the dryness. Sjogren's is not helping. Oh, look at it. It advanced before it. Let me read the whole thing. Pamela says, all my doctors want to do is a dipstick for tests before dressing, saying blood in it, and then call in med, then starts a yeast infection. So Pamela, really, you can go years with a doctor doing that, never getting better. We had one research study that followed women for 10 years, 10 freaking years of them taking antibiotics. And they did it was a retrospective study. They went back into their charts And guess what? Out of these 50 women, how many had a positive urine culture? One. The rest of them took antibiotics unnecessarily for 10 years, only to discover after the fact that it was never helpful. So, in this circumstance, Pamela, in my opinion, before you know, before you embark on another course of antibiotics, I think it's important to identify the infection. Because listen, guys, if you do a dipstick test, there are two pads on it for a typical azo dipstick: leukocytes and nitrites. Leukocytes test for white blood cells, nitrites test for nitrites, which are only produced by bacteria. If you've got a double positive leukocyte nitrite, yeah, you got infection. If you've got leukocytes, like my dad did the other night, that's not infection. That's usually irritation or injury. You've irritated the bladder. The human body has sent blood vessels, white blood cells up to that area. That's kind of one of the interesting things. So look at here are your blood vessels. See these holes right here? See, there's a blood vessel. There's a blood vessel. Human healing is fascinating. It's absolutely fascinating because your bladder is somehow able to communicate that something in your urine is where it shouldn't be. Something has reached this level of cells. And people think of the bladder wall as a passive organ. It's not. It's a very dynamic organ. There's a lot of communication happening. And one of the things that happens when you've got irritants in your urine reaching this level of cells is that your body sends white blood cells to the area because they're your fighters. They're the ones that fight infection. They're the ones that fight all sorts of things. So here, white blood cells are being sent here to these blood vessels, these small capillaries. But how do the white blood cells get here to fight whatever it is? The capillaries release them. The capillaries open. And when the capillaries open, what happens? White blood cells are released, but so are red blood cells. And that's why a lot of injury patients have microscopic blood in their urine. It doesn't signify an infection. What it signifies is that there could be injury. Your body is trying to fix the injury. It's flooding the area with blood cells, especially white blood cells. But those capillaries have to open to let them out. And when it does, it lets red blood cells out too. All right, you guys, Facebook, you here, it's just flying by. Hold on a sec. There's some good stuff happening here. Sandy says bladderhealth.com does not work. Sandy, I don't know why you're saying that. I would like to hear why you think that, because I have sent hundreds, if not thousands of patients there, and for many of them, it is working. It is identifying fungal infections. It is identifying other infections, but it's tricky. We're learning a lot about the biome right now, and it's at the forefront of IC and bladder research right now. But that is not true. It works for quite a few people, but not all of them. Oh, I'm sorry. I see the problem. It's not .com, it's .org. Oh, I'm sorry. Did I say it wrong? My bad. Pamela says, you're in the bathroom 90 to 100 times a day. Okay, Pamela, seriously, that tells me that your bladder wall is effed up. And generally, when we see that level of frequency, that tells me that your bladder wall is profoundly damaged. Again, Hunter's lesion, possibly, probably. But it also tells me that there's something in your daily life that is probably irritating it that much worse. Like coffee. If you're drinking even 1 cup of coffee a day, that can drive all of that. If you're drinking cranberry juice, orange juice, green tea, black tea, if you're drinking water out of a Brita water filter, that produces acid water. If you're taking a multivitamin, there are so many things that can trigger constant chronic bladder irritation that just gets worse and worse and worse and worse until you are in the bathroom 90 times a day. At that point in time, hun, you've got to come on over to our website, look at the diet list. We've got to absolutely make sure you're not accidentally shooting yourself in the bladder with something that you're intaking. We need to look at your supplements, make sure you're not doing a supplement that is triggering you. As an example, Sandy says she does marshmallow. And that's great, Sandy. I'm glad marshmallow is working for you, but marshmallow actually bothers about 50% of the people who try it. Also, Pamela, I hope you'll give me a phone call this week because I'd really love to talk to you. Over on our website, icnetwork.org, we have a whole list of confusable conditions that need to be ruled out. If your symptoms are that extreme, what the AUA says is if you're not responding to therapy and you're getting worse rather than better, man, we got to back off here and revisit this diagnosis. Is there any chance you have a fibroid tumor pushing on your bladder? Is there any chance that you've got endometriosis that is attached to your bladder, if not going through your bladder wall? Is there any history of any other pelvic trauma, anything at all like that? Could you have a Tarlov cyst? Could you have chronically tight muscles? Could you have, again, a chronic fungal infection, a viral infection, or a bacterial infection? There are lots and lots of things which can trigger these symptoms. I would really love to work with you. So you say you've been gluten-free, acid-free, no underground food. Okay, that's good. That's a start. But are you drinking alkaline water all day? Because if you're drinking alkaline water all day, that'll also trigger it. Remember, bleach will eat your eyeballs out just as quickly as sulfuric acid. Your goal is to be pH neutral. You shouldn't be doing alkaline water all day either. Sharon says, I can get no sleep at night. I'm up every hour to pee. Bladder spasms. I'm at my wit's end. I even went in and had my bladder stretched and done no good. Well, we don't really stretch the bladder so much anymore, Sharon. Number one, we have to look at the quality and health of your skin. Do you have estrogen atrophy? If you have estrogen atrophy, then doing something that has a coating effect, like a chondroitin supplement, might be very helpful. Lauren says, has a good evening. She got to go cook dinner. What time is it? It's almost 2 o'clock here. Callie says, for Icy Awareness Month, we should include something for COVID this year. Yeah, it's going to be very interesting to see where we are in August. I'm going to predict that the virus is going to be absolutely raging throughout the United States. I hate to say it, but I think that's going to happen. Vicki, it's not necessarily full-blown autoimmune. Rather, it's full body inflammation where it's just hitting worse in your system. Yeah, and I will say, guys, cyclosporin, which is a step 5 treatment strategy, that's where that would really shine with somebody who's got an autoimmune issue. Jen says, I need help so bad. I'm on day 4 of the worst flare, but I believe it's a UTI. I have fire burning inside my vagina into my bladder like a torch, just holding there and torturing me. I took Azo and had Keflex that I started. I found a specialist who specializes in endo. I have severe endo. I've urinated 14 times in 10 minutes. He catheterized me and emptied me. He looked at me and he said, it's my IC, and to see his partner. He looked dead in the eyes and said, I was sexually abused as a child and early adult. What? 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 Now listen, we do know that if you have a history of sexual abuse, that your pelvic floor could be screwed up because of that. You could have tight muscles, or you could be tightening muscles as a reflex. But when you've got a fire inside your vagina, we have to remember that tight pelvic floor muscles cause a burning sensation. So that heat could be tight muscles. But Jen, are your symptoms positional? Are you fine when you stand, but when you sit down, it hurts? Or when you bend over, it hurts? I have to wonder, the language that you're using, fire, actually sounds a bit like nerve to me also. I wonder if you could have a little bit of pudendal neuralgia going on. But again, this is unraveling layers. We got to just roll stuff out slowly and consistently. You could order a next generation test if you wanted to. That's okay. It would be interesting to see if you do have a bacterial infection or a fungal infection. If your skin is dry, we're looking at estrogen atrophy. But is there any chemical that's irritating your bladder? That's a possibility too. And the endometriosis is tricky, hon. I mean, because the endo can attach to the outside of your bladder and mess with your bladder. Have they talked about doing a laparoscopy to look at the endo and perhaps remove some of it, or to look at your bladder and see if it was affecting it? Vicky says, "Am I hiring for working at home?" Oh, hell yeah! Are you kidding? Everybody for the IC network pretty much works from home except up in our warehouse. I love hiring IC patients. That's what I try to do because I want you to know that you can do great things, even if you've got a tender bladder, period. Kari says, the part about biology, all of this, that is me, but there must have been at least 3 subtypes I have. Yeah. Lindsay says, can you take bladder rest with Peora? Yes. Gay is watching. Hi, Gay. Nerton says, I have Hunter's ulcers. What's the possible cause and treatment? I'm on IC taking bladder rest and have had fulguration. So again, Nerton, the reality here is that Hunter's lesions continue to remain one of the mysteries of IC, and that is, why do lesions occur in the first place? We have research from Europe that suggests that it's a viral infection, the polyoma BK or the Epstein-Barr virus, even HPV, or even we know that some patients with herpes, when they have a herpes outbreak, that they can flare much more seriously. But the other theory about a Hunter's lesion is that it is a nerve that's basically running amok, that it is a nerve that is massively, massively, massively inflamed. And an inflamed nerve releases something called substance P, which damages tissue. Interestingly, one of the clues that we have is from the one treatment in history to heal Hunter's lesions, and that treatment is called Liris, Liris. Liris. It is not currently available. It is the first treatment in history to heal Hunter's lesions in just 2 weeks. So imagine a soft, hollow piece of spaghetti filled with lidocaine. So this was a medical device. It was created at MIT as a way of delivering medication to the bladder, because the problem with treating the bladder with medication is you pee it out. So MIT was given the challenge: how can we get medicine into the bladder that will stay in the bladder for a period of time? And what they did is they created Liris. So it's like a small hollow piece of spaghetti about this long filled with medicine. What they do is they put it through the urethra into the bladder, where it sits in the bladder for 2 weeks, and it kind of folds on itself, so it won't fall out again. And obviously you have to insert something in the urethra to pull it out. They grab a tip and pull it out. So it was created first for bladder pain, and really, I think bladder pain associated with bladder cancer, I think, was their original motivation. And in that first research study that was done up in Canada, that I think was like 12 patients, half of whom had Hunter's lesions, they were stunned to discover that the lesions disappeared after 2 weeks. And the quote from the research study was, a complete and total resolution of the lesion. That was the actual quote from the research study and paper that was presented on it. So why? Why would lidocaine make a lesion heal? What does lidocaine do? It numbs nerves. It numbs nerves. So either it's numbing a nerve that's massively inflamed, or it's numbing a nerve which is making it hard for the virus to operate. Liris was deprioritized by Allergan either the last year or the year before, which means that they shelved it. I think they decided they weren't going to make enough money with it. And so tragically, it is not available. So if you come over to the IC Network, icnetwork.org, we have a whole section on Hunter's ulcers or Hunter's lesions. And I think you could do steroid injections. They find that if they inject a steroid to calm inflammation in the lesion, that the lesion will calm down dramatically. Veronica said, I had a hydrodistension and nothing was found. Awesome. That's great news. I had a hydrodistension 3 years ago after my hysterectomy. Again, nothing found. So that's good news. That means that your bladder is in good health. And that also means that your symptoms are being triggered by something else. And that's what we got to figure out, right? That's what we got to figure out is it your pelvic floor? Here, guys, give me 1 sec. I'll be right back. Hey, man, bio break. I need to pee. I'll be right back. I gotta say, listen, when I started the IC network, I was Miss Academic. We talked about urination and defecation. We didn't talk about peeing and pooping. Okay, it's 27 years later. We talk about peeing and pooping now. It's just what most people relate to. I'm not always talking with doctors. I'm talking with patients who literally, some of you might not even, I work with some patients who literally don't know what those words mean. So we got to get real simple. Oh my God, did I get bitten by something? I hate bug bites. Is that a bug bite? Oh, I hope not. Looks like it. Darn it. Mosquito season has started. Work. I have the worst reactions to bug bites. I hate them with a passion. All right. So a positive, a good hydrodissension, I say hallelujah. That's awesome. That tells us that your issue is not your bladder. That's good, valuable information. All right, YouTube. Hello, Donna. Hi, Barbara. Barbara says, oh my God, I will work for the IC Network for free. Well, that would be great. If y'all want to, we can put together a committee for IC Awareness Month. Donna was incredible last year. In fact, Donna's the one who made this shirt, IC Strong. We got to come up with some new stuff. Barbara says, Jill, would the neobladder work for somebody with IC? Well, Barbara, okay, so again, it depends upon your subtype. If you are IC subtype 5, central sensitization, no. If you're IC subtype 4, pudendal neuralgia, no. If you're IC subtype 3, pelvic floor, no. If you're IC subtype 2, bladder wall injury, and your bladder is profoundly damaged and small, then the answer might be yes. Meg says, I haven't responded to various therapies except gabapentin, but my new urologist says he wants to stretch my urethra along with doing his own cysto. Oh, Meg, I wish okay. I wish you'd been here at the beginning of the meeting because we talked a little bit about old outdated therapies, specifically silver nitrate and chlorpactin. But the other old outdated therapy is urethral dilation, which other doctors call raping the urethra. Think about it. If and this was true for me when I was younger. I had a very, very tight urethra, and it felt like I was peeing through a needle. And what did they do? They go in and they forced it open. So imagine you've got a tight urethra, and what they do is they just try to numb it and stick it through there and try to get it to open up. Okay. That's what they did in the 60s, 70s, and 80s. That's what we don't normally do that in 2020. Now we ask ourselves, why is the freaking urethra tight in the first place? And the answer is tight urinary diaphragm muscles. So now, rather than trying to force the urethra open, now, of course, if you were completely blocked and unable to void, then yes, they've got to go in and do it as an emergency procedure. But now we ask ourselves, why is it tight in the first place? And again, it's about tight pelvic floor muscles. Zana says, where do I go to find a list of supplements? I believe I have 3 of those categories that you're talking about. Hun, if you over to the IC network and just click on shop, you'll see them there. And I have on our website under treatments, under step 1 treatments, there is a supplement overview that you can look at. And I'm not doing this to sell supplements, guy. I'll tell you exactly. Let me just um Oh, Kari says, how do we watch live, not on Facebook? On YouTube. We're live on YouTube right now on our channel. John says, does low testosterone affect the bladder in males? I don't understand how the bladder influences how testosterone influences the bladder, to be quite honest, John. So I don't know. I just don't know. And I need to do an article on it, and I need to talk with my medical board on it. I really, truly, honestly don't know. Now, I just want to say one thing really quickly. Remember, we're a support group. I'm not doing this meeting to sell you stuff. I'm doing this meeting to show you what your options are. And when I started the IC network for 5 years, we didn't sell anything. It was free to everybody, yada, yada, yada. And we had 200,000 patients a month visiting our website. But it did get to the point where it was really expensive to do, and I had no money. I went through my savings and I wasn't working because of my own IC. And so we had to change our format so that we could bring some money in to pay our internet bills, which, were sizable back then, and to do various things that we needed to do. And so I decided to open a shop. But we sold books and chair cushions and heating pads. We didn't sell supplements. We didn't have supplements back then, but I didn't do this to sell supplements. But I'll tell you exactly what changed my mind. It was over InterStim. So if you guys know InterStim neuromodulation, uh, on back then we called Medtronic the Darth Vader of the IC world because they kind of swooped into meetings and their pitch to doctors back then, and it might not have been written, but the ones that I saw, and I was at the conferences and the classes, it was kind of the way they pitched InterStim was, those patients who always annoy you, the patients they call all the time, they're bothering you, they're in flares, they're asking for help, they're taking staff time, et cetera, et cetera. You can get rid of them if you do this medical advice. They won't bother you anymore. And InterStim, this surgical neuromodulation, came on like gangbusters. And all of a sudden, we had doctors who were not telling patients about diet. They weren't telling patients about Elmeron. We had a doctor in Utah who basically set up his clinic as an InterStim factory and said, "You've got IC, your only therapy is surgery." And some of those patients had really severe complications, and they found me and they found us and they found the IC, and they went, wait a second, my doctor didn't tell me about anything. I didn't know about Elmeron. I didn't know about any other meds. I didn't even know about the diet. And this doctor was making buku bucks by doing these surgeries all day, several times a week. And it just like dawned on me at that point that a patient like that needed to know their options. And supplements, because the early ones were created by IC researchers, were viable options. And that's exactly why I went, you know what? Patients needed one place where they could go, where they could see all of their options. And at that time, it was Sister Q and Desert Harvest Aloe. And then Sister Protect came along. We did the product launch for that. And I was very, very, very happy to be affirmed in my position by the American Urology Association when they released their AUA guidelines in 2011. In step 1, they said, please try the supplements first, because the supplements have fewer side effects than Elmeron and Elavil and Atarax and Vistaril. And so, this is, my goal with the IC network is to show you what your options are. I don't want you to think that I am trying to sell you anything. We are free. This support group meeting is free. My website is free. I want you to be empowered. And if you want to try supplements, we have them. And if you don't, that is fine. No shame, no blame. Okay? All right, let's go back to your questions. Sherry says, I'm having a good day as long as I'm on my pain pills. Yeeks. That's not a good day, Sherry. Shannon says, does InnerStim help you? That is the next step for me. Shannon, there are two forms of neuromodulation. There is urgent PC, which is ankle stimulation, hits the same nerve, or you can do the surgical InnerStim, which hits a nerve up by the spinal cord. You got to understand the difference. InnerStim is associated with thousands of serious adverse events. If you go to the MAUDE database, think about the old TV show MAUDE, MAUDE. If you Google MAUDE FDA database, that is the publicly maintained and accessible database for medical device complications. And if you put InnerStim in there, and make sure you go back like 5 years, you will find thousands of adverse events. Most of them are deep tissue MRSA. In fact, one of them was filed with a doctor, and he kept saying, the risk of infection is so profound with InnerStim. Why? Because the surgery is done basically down by your rectum. And I mean, it's not at your rectum, it's in your lower spine by your sacrum, but there's still a lot of extra bacteria there. And he actually, one of his issues that he sent to the FDA is, why is there such an abundant population of E. coli on this tissue? And the only answer that they could provide is that ultimately it's about the location. The ankle stimulation is 4 feet from that area and has much fewer bacteria, unless you're walking barefoot in the beach. Then you're running the risk. I was one of the first ankle stim patients. It was invented by Dr. Marshall Stoller at UC San Francisco. InnerStim was also invented by Dr. Richard Schmidt at UC San Francisco. And Marshall Stoller created the ankle stim because he was so outraged by the treatment that the patients were getting who were doing the spinal surgery. And so he said, guys, you can hit the same nerve at the ankle. And ironically, they look for the same thing, and that is the big toe. When you turn the stimulator on, if the big toe bends down or the outer toes splay out, that means that the correct nerve has been accessed. So let me see if I can contort myself. Okay, hold on. I don't know if you can see that little black spot right there. That little black spot is the tattoo they gave me to insert the needles. And so here is my ankle bone. So it's basically 3 fingers up your ankle bone. And so there's the spot right there. You know what? Let me get a pen. Hold on. Let me see if I can mark it. All right. Okay. Oh, this is so hard. I'm trying to get in the right position. Okay. Okay, see that spot right there? That is the SP, S is the Sam, P is in Paul, 6 acupuncture point. It is 3 fingers up from your ankle bone, and it's about a finger below. So if you look at the center, so the center is like this, right? So the center line is right here. So you can see that's about 1 finger below center. They put an acupuncture needle in here, and it doesn't go straight. You actually have to, it goes down a little bit and back a little bit to actually hit the needle. I actually flew with Dr. Marshall Stoller to England to appear on the BBC. We did radio and TV where I was the test dummy And so I had that done on TV as they demonstrated it. So ankle stem is much, much, much safer and cheaper. So what they did is you sit on a table. You're basically, sitting on a table with your legs up and out like this, right? And they put a needle on both sides. They attach a TENS unit to find out which one is better positioned by the nerve. And again, they turn the stimulator on and they look at what your toes do. Your outer toes flex out or your big toe bends down. And it's perfect if the big toe bends down. Now, the thing here is that it should never hurt. Never, ever hurt. So as they turn it on, you're going to feel the vibration. And then you might start crossing a pain threshold. And that's when it starts to hurt. You always back it off. It should never hurt. You should just feel tingling or, kind of the fluttering, stimulating feeling. You do that 20 to 30 minutes once a week for 10 to 12 weeks. It broke me out of a terrible flare. I had been in agonizing pain for a year. At week 3, I had my first hour without pain. At week 7, I had my first day without pain. And that was incredible. Now, Dr. Marshall Stoller obviously isn't doing it anymore. A new company, Urgent PC, is the one that's doing it. Their attention to placement is not as good as Dr. Stoller. Dr. Stoller had a hold on. Dr. Stoller was much better at placing the needle. He taught us to place the needles. I did it at home. They gave me acupuncture needles, and I did it at home for a couple of years. Super, super easy. No side effects. No side effects for me. Except, after a while, your skin gets a little sensitive. That's for sure. Now, here's the other issue. Let's look at InterStim for a moment. InterStim requires at least 2 surgeries. InterStim has thousands of severe adverse events, including deaths. The last time I counted, I think I counted 19 or 20 fatalities associated with InterStim, including the heart rhythm using the same rhythm as the InterStim. So there have been deaths with InterStim. You've got to understand that. But the other thing with InterStim that people really underestimate is that it requires a lot of attention. You can't just have an InterStim and walk away. InterStim devices malfunction. InterStim devices change. They move. And it's got to be checked regularly, once every 3 months, once every 6 months. If you have a pacemaker, that's how often they check your pacemaker. This is kind of like a spinal pacemaker. But the last thing you need to understand about InterStim is that money matters. We had a very important case of a nurse with IC, and she was like in Kentucky, somewhere in there, small town, 3 urologists in town. Every single one of them said, girl, you got to have InterStim. And she really honestly felt, forced into it because they weren't going to treat her with anything else. That's what they said. We're not going to see you unless you do InterStim. Well, the doctor said it was covered by her insurance. Now, she was a nurse. She's an RN. She went to the billing office in the doctor's office. Is this covered by insurance? They said, absolutely no written pre-authorization required. She called the hospital billing office. Are you sure this is covered? They went, absolutely covered, not a problem. Then, out of an abundance of caution, she called the health insurance company, her health insurance company, and said, is this covered by you? And they said, absolutely. You don't need a written pre-authorization. You're fine. You're gold. She has a surgery. A week later, she had a bill for over $50,000 and a threat to garnish her wages because guess what? It wasn't covered by her insurance. And guess what? She didn't get it in writing. So I always tell everybody who's getting InterStim, you better damn well make sure you get it in writing from the doctor, from the hospital, and from the insurance company so that that doesn't happen to you. Because the last time I talked to her, they had garnished her wages on and she was a nurse at that hospital. And what she said is, if I had known, I would never have agreed to this because I certainly didn't have the money to pay for it. Okay. So you got to understand that word of mouth is not necessarily accurate. All righty. Whoops. Hold on. I messed it up. Okay. Carrie says, "What are we trying to win?" I haven't done anything yet. Lindsay says, "What's Azone? Where to get it?" It's in our store. You can get it pretty much at any drugstore. It's the over-counter version of Pyridium. It numbs your bladder wall. It's not going to work for severe pain. It's not going to work for Hunner's lesions. Might take the edge off just a little bit, but you're not meant to take Azo every day. Azo can be damaging. Carol says, "Hi, Jill. Been suffering over 3 weeks after going into a jacuzzi. My doctor put me on an antibiotic and Pyridium. Not better. Going to my doctor on Tuesday. He set up an order to go to a lab because he thinks it's a flare, not a UTI. So frustrating. He mentioned Elmeron. I said, no way. All right. So what do we know about jacuzzis according to the Center for Disease Control? We know that jacuzzis harbor very diverse infections, and it may be an unusual infection. It may not be an infection that will grow out on a typical urine culture. And so, to me, Carol, that makes a next generation test absolutely a priority in that case because we just don't know. So, having a typical urinalysis is fine, but it might be reasonable to go one step higher and ask for a next generation test. Um, you could have a chemical injury from the chemicals, and that's possible. And so you got to think about calming and soothing your bladder. So, one of the things that you could potentially ask for is a rescue installation. Ask if you would consider doing a heparin lidocaine installation, which would numb your bladder wall immediately and for several hours. Elmeron does not provide a pain reducing effect. All Elmeron will do is provide a bit of a coating over time, and it's certainly not instantaneous. And the point is that you're in pain now. You are in pain now. And so that's why they call it a rescue installation, because it can rescue you out of that pain. Gwen says, "I can literally eat or drink something within 3 to 5 minutes. My bladder and vulva will take me burning. How do I deal with this?" So Gwen, it is physiologically impossible for food to get into your urine in 3 to 5 minutes. However, it can certainly irritate your nerves and things like that. And so, caffeine, for example, if you're doing something with caffeine is neurostimulatory. It makes people pee and poop within 5 or 10 minutes for some people. So it could be something that's neuroinflammatory that's triggering that frequency urgency. That would be one of the things that I would be looking at first is what are you eating or drinking, and could it be neurostimulatory? But, I mean, like, if you had a 7 Up, I think one of the worst diet flares I had was, when I went to see a Harrison Ford movie with my boyfriend at the time, Mr. Todd. His name was Todd at the time. And it was, uh I remember exactly where it was. The theater was packed. I got a 7 Up. It was a fountain 7 Up, not a can. And that thing was pure acid. And within 45 minutes, 30 to 45 minutes, I was insane with pain. Holy hell. I think in that movie, I must have gotten up 4 times. And then he and his friends, they all wanted to go out to dinner. And I just ran to my car bawling and drove home because that soda was so devastating. That was when, my IC was in my first year when I had my chemical burn. Julie says, "Are all urologists trained in IC?" Absolutely not. No. Is there an IC specialist, one near you in South Carolina? Well, you've got Deborah Erickson at the University of Kentucky, who is a major IC researcher. Although I did hear kind of through the grapevine that she doesn't want to treat patients as much. But you also happen to have the top doctor in the nation, Dr. Robert Evans, up in North Carolina at Wake Forest, if you're willing to go there. Lindsay says, what water do I recommend? Spring water. Spring water. Carol says, I don't drink coffee anymore. Gwen says, what is fulguration? It's where they heat the tissue. It's kind of like cauterization. Vicky says, do over-the-counter fungal treatments work? The answer is no, not usually. If you've got systemic candida, especially drug-resistant candida, it could be a bitch. Drug-resistant candida is considered in the top 10 threats by the Center for Disease Control. It is known for killing people. If you get a systemic drug-resistant fungal infection in a hospital, it can be very, very dangerous. So you've got to take them very, very seriously. Shannon says, after intercourse, I get a flare-up. What can I do? Yes, Shannon, the flare that you're getting with sex is a muscle flare. It's not a bladder wall flare. It's a muscle flare. And so generally what you do is take a hot shower afterwards. Use a heating pad that will relax muscles. If you have a muscle relaxant, if you've got vaginal Valium, that's generally what will get you through that sex-induced flare. Of course, listen, if the moment of penetration, as his penis is entering your vagina, if that is agonizingly painful, that means you've got very, very tight muscles. Also remember too that slippery matters. Dry skin on dry skin is not a good thing. Over on our website, icnetwork.org, we've got a whole section on sex with a lot of tips on what you can do to make sex more comfortable. Okay, like literally a half a tube of KY per sex act is the way to get so slippery that you're not going to get any skin irritation injury. But if you've got tight pelvic floor muscles, certain positions might hurt and others won't. So go on over to the website, icnetwork.org, and read that section on sex. Also, we do have a really good, there is a really good book on the market called Secret Suffering that you could get if you wanted more information on that, but you have to get it from Amazon. I don't think we sell it anymore. All right, literally my mouse is being weird here. Sherry says, I think the virus is very wicked. Guys, it is very wicked. The thing about the virus that you've got to understand is it's not just affecting the lungs, it's affecting other parts of our body. It is attacking the circulatory system. It is triggering blood clots. People in their 20s and 30s are having strokes and coming out of the hospital paralyzed on one side. It is, you get COVID toes, COVID fingers, where you look like you have frostbite. They think that's a virus attacking the blood vessels in your fingers. It attacks the kidneys. Uh, uh, and I was just reading a paper yesterday where I think it was about the Teddy Roosevelt aircraft carrier, where sailors who had it and then tested negative are testing positive again. And they're seeing that in Wuhan too, is that people who've had it before can get it again. And so this is not a little thing. And regardless of what politics are saying, it is in your best interest, in your family's best interest to protect yourself, wear a mask, stay away from large crowds. And seriously, it's going to be that way for the rest of the year. You got to be smart. I have no intention of going to a movie until next year, even though I want to see the new Top Gun that's supposed to come out. And nor do I anticipate going. I'm getting a lot of takeout from restaurants to help them. But I don't expect to go sit in because, again, I've got a 97-year-old and a 91-year-old in my house, and I've got to protect them. But this is not a little thing. This is a very, very, very dangerous virus, and we've all got to be smart here. Ignore the politicians. Think about your family. Think about your health, and make good decisions. Trudy says, I tried Bladder Builder, but it gave you a stomach ache. Any other suggestions? Yeah, Bladder Builder is a very, very robust formula. And there's a lot of stuff in it, especially the probiotics. It's got the PEA. It's got collagen in it. It's got some amino acids in it. And so, if you're somebody who tends to be a bit more sensitive like me, then you need to do a cleaner, simpler formula. And so, you could try bladder rest. Bladder rest might be real. Um, Again, for in my case, because my bladder is entirely healthy. If you look at my bladder wall is fine. It's my nervous system that's the problem. So when my nervous system start acting up, I take Pura. And I always know it's starting to act up because I start getting pinpricks. I was getting a lot of pinpricks around my ankles and on my arms. And that tells me that my central sensitization is amping up again. And so the way I'm bringing it down is with Pura. And I'm absolutely thrilled when the big ICPEA research study came out. I went to the National Library of Medicine and I looked at all the research studies for fibromyalgia and sciatica and burning mouth syndrome and all this sort of stuff. And the conclusion was that PEA, palmitoethanolamide, was particularly effective for nerve pain. And that's why I decided to try. And I'm telling you, like, I'm 50% better. I was really bad 2 days ago. I was just feeling lots of pinpricks, and it's hard to sleep, like, it's like you pinprick here, all over the place. And I just took 1 pill, 2 nights ago, and it's 75% better, and if I take another couple of pills, it will calm down for another couple of weeks, and then we'll see. But I was taking pain pills to sleep, I at least I'm gonna say maybe 3 or 4 times a year. My pin pricking was so bad, the only way I could sleep was with, a little bit of Norco. Hello, being a redhead. It sucks sometimes. Becky, thank you, hon. It's very sweet. Gwen says, "What kind of pain meds can I ask for?" Tylenol, Valium, but the burning spasms are horrible. I do estrogen. So Gwen, you've got to understand that you've got 2 different types of muscles. You've got the smooth muscle of the bladder wall and the striated muscle of the pelvic floor. And they respond to different medications. So if you're having bladder wall spasms, you're going to be using something like oxybutynin, ditropan, Detrol. Those are smooth muscle relaxants. So a bladder spasm, I mean, I've only had bladder spasms once badly, and it was when I had a really bad bladder infection that we thought was a flare for 6 weeks, and it would just getting worse and worse and worse. I mean, I've had 2 bladder infections in 27 years. This was the second one. And I got to the point where it was just agony. And so what was happening is when I started to pee, it was like my it was like the pain would shoot up my spinal cord and I would literally be on the toilet and I would go like this, you know? I was like, "Oh my god, what is this?" And you're doing this for like 5 minutes as the spasm goes through its thing. And ditropan, I ended up going to my urologist. I walked in, which I never did. I was their support group leader for 15 years. They had never seen me cry. I had never walked in before. I walked in sobbing and they pulled me in right away. And I was describing this symptom. It's like as my urine's coming out, this thing is happening. And she kind of patted me on my shoulder and went, "Jill, don't you know you're having bladder spasms?" And I went, "No, I've never had these before." They gave me ditropan, and it literally within 20 minutes, it turned off. So the only time I ever used ditropan was around those bladder spasms, which lasted for about 10 days until it resolved. Pelvic floor spasms are different. Pelvic floor spasms, you have to use a skeletal muscle relaxant. So that's going to be Flexeril, baclofen, or Valium. Gwen, you say you have burning spasms. Where? Where are your burning spasms? They in your vagina? Okay, why did this mouse stop working? That is so weird. Brittany says, can a bladder wall injury be ruled out by cysto without hydrodistension, or is a hydrodistension needed? The advantage of doing a plain cystoscopy is I call it a looky-loo. It's a very quick, 5 minutes. They just numb your urethra, stick a cystoscope in, look around, pull it out, you're done. And the cystoscopy would indeed see major injuries, and it certainly would reveal bladder stones, which are possible. And so if it were something really, really profound, or even a stitch through your bladder wall, or endometriosis coming through your bladder wall, or a bladder cancer, anything at all like that, a cystoscopy should see it. There's something called a narrowband imaging. If your doctor has can do a cystoscopy with narrowband imaging, they can then also do a much closer look at the bladder wall and potentially see any Hunner's lesions. But big Hunner's lesions, I mean, if somebody's got a Hunner's lesion, their bladder's going to be really red and really inflamed. They might not actually see the scope and the extent of the lesion with the cystoscopy, but it would certainly show it. Okay, guys. So, like, seriously, hey, Donna, you're in here. Donna. If you could help, what we need to do is collect names. Let's put together a committee of people who want to work on IC Awareness Month, and let's see what we can do. Maybe we can get a pharmaceutical company to underwrite part of it. Of course, Elmeron's out. They're probably quite mad at the IC community right now for talking about the lawsuit. So we're not going to be able to ask them. But we might be able to get a supplement company to throw out some money to do stuff. So anybody who wants to work on IC Awareness Month, if you could email me icnetwork@me.com. No, at mac.com. Well, they both work. icnetwork@mac.com. M as in Mary, A as in Apple, C as in Charlie, mac.com. If you would like to work on IC Awareness Month, that would be great. And let's see what we can do to brainstorm and do some stuff. And we'll do Zoom meetings. And I think I'm gonna start a Zoom meeting anyway. I think maybe once a week we'll send out invites uh, for people who want to do a Zoom meeting for IC. Wouldn't that be cool? Lindsay says, "I think my type is tight pelvic floor muscles. Can I drink stevia?" I no, I don't think so. The problem with the artificial sugars is we really don't necessarily understand their long-term toll on the bladder. We know that aspartame is metabolic precursor to formaldehyde. We know that bladder wall irritation is very common with aspartame. Um, I'm not comfortable with any artificial sugar, to be quite honest. I'm just not. I mean, I think honey, a little bit of honey, if you can do it, would be ideal. You guys, you got to understand the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. The reality is that they're both involved to some degree because they're so interconnected. Generally, if you've got your bladder screaming, your muscles are going to be tight in a guarding reflex. It's called a viscerosomatic reflex. But if your muscles are tight, we also know that that can change your bladder, and that's called a somatovisceral reflex. Your goal is to figure out which one's driving which one. One's primary and one's secondary. If your pelvic floor is your primary, that your symptoms started after having a baby or a fall or a rape or something like that, then yeah, your therapeutic priority is to restore blood flow and work on those muscles. But you got to understand your bladder is going to be vulnerable. Uh, and they're all connected. So it's not like you can just not follow the diet while you're doing physical therapy. They're too interconnected. You've got to protect your bladder too. Donna, hey, Donna, yeah, Donna, thank you. Vicky said, in the book you recommend, the first success he had was with adhesive magnets on the ankle. Yeah, but remember, it wasn't that big, and he moved on very, very quickly. He does not support magnet therapy at all. Shannon says, I have a TENS machine at home. If I put the TENS machine in that same spot, would that work? A lot of patients have tried that. Even I tried that. Um, it doesn't get deep enough to hit the nerve effectively. Interestingly, Dr. Marshall Stoller's original vision for ankle stem was to be able to implant a little round stimulator surgically, like a little, like this, like I think he said the size of a dime, and that did not happen. But another company has actually created an implant that is like a little stick that gets put at the SP6 joint. But the TENS machine, it's just not. I don't believe that it's been that effective. Lee says being sick is too expensive, ridiculous, and sad. That's why we need affordable health care for everyone. And we've gotta start negotiating with these drug companies to reduce their prices. I mean, you gotta understand that lobbyists are evil, and a lobbyist back during the Reagan administration was able to pay off a senator to pass a law that got rid of pharmaceutical companies having to negotiate fair prices for Medicare. And since that time, drug companies have been able to set their own prices, and prices increase steadily. We need that again. We need to take back that power, because it is real that when somebody in Canada pays $15 for a drug and here it's $200 and it's the exact same thing made at the same factory, that's just greed. That's absolute greed. Barbara says, can you message me when you get done or call now? Hi, when we're done, you're welcome to give me a phone call. You got my number, right? And guys, generally I take at least half of Monday off because I'm working today. So if you call early tomorrow, I probably won't be here to answer the phone. I will probably be in bed. Jana says, do interstems work? Interstems, if you can afford it, if you're comfortable with the risks, you're well informed about the risks of adverse events, including fatalities, which have happened, Janice. We talked about this earlier. The one place where InterStim shines is with incontinence. If you have fecal incontinence or urine incontinence, InterStim can be an absolute life changer. But generally, we want to start with the least invasive first. Urgent PC, the ankle stimulation, has exactly the same approval under Medicare for exactly the same thing at a fraction of the price, like 10% of the price, without the risk of serious damage. And so most people start with ankle neuromodulation known as urgent PC. Gwen said, your next generation test came back basically normal. Good. Okay, that's good news. Then that's good news. We can walk away from that theory now. Now you've got to focus on muscles and anything else that could be going on. Lindsay says, I want to make an appointment with you, please. Lindsay, I answer the phone almost every day. You're welcome to call, or you can sign up for coaching. People who sign up for coaching always get first priority. Otherwise, it's first come, first serve. And you can sign up for coaching on our website, icnetwork@mac.com. Go into our store, and it's $50. But if you can't afford it, that's not a problem. Literally, a lot of you just call and I answer the phone and we talk and there's nothing. But if you want to be put up into the list, and if you think my time is valuable, it's or you want to spend a lot of time, if it's a 5 or 10-minute question, it's not a problem. But if you want to spend an hour talking in depth about your symptoms, it's really, really nice if you sign up for coaching, because that's a significant amount of my time. Lisa, what are you saying? I will work on it if I can get someone to shift focus from COVID. I have a Zoom subscription, but I've never had more than 8 at a time. Hey, Lisa, it would be great if you could walk me through it, because I've actually never done a Zoom meeting. I do pretty good given my internet. Brittany, I've developed anemia from taking too much azo for a month. My urologist said she'd never seen that happen with azo and doubted that's what caused my anemia. But I stopped the azo and my blood work returned back to normal. That's why iridium azo is never meant to be used every day. You're only supposed to use it for 3 to 4 days at the most. Sarah, I'm just fed up, infection again and irradiated. Is there anything you can suggest plus getting a lot of spasms? So Sarah, um women of a certain age, because we start losing estrogen, what happens is our protective barrier, our mucosal barrier gets thinner and thinner and thinner. So, what that means is bacteria can much more easily infect those cells. I took a class taught by Dr. Anthony Schaefer at the American Urology Association years ago, and it talks specifically about women who get chronic urinary tract infections. And they, believe me, they have done a bunch of research trying to figure out why women seem to get so many infections. And so they were testing every day. They were doing urine sampling, they were doing vaginal sampling of the mucosal barrier, they were doing, uh, um, um, bowel biopsy, not biopsies, cultures. This is what happens when you talk a lot. And here's what happened. What they found was that the bacteria was in the vagina consistently 24 hours before it arrived in the bladder. So then the researchers were like, well, what happened to the vaginal defenses? Why has the vagina become a safe haven for bacteria? And the answer comes right back to estrogen atrophy because that's also happening in your vagina. You're losing your mucosal barrier in the vagina. So, what he said is a woman who gets recurring infections, we never call them simple infections. We always call them complex infection. And almost always, in addition to the antibiotic, we give them an estrogen prescription that they can use vaginally to try to toughen up their defenses and produce mucus in the vagina. And a lot of women don't understand the importance of that. They don't understand that the quality and health of your skin matters, especially down below. The other thing that happens as you get older is your pH changes, and as your pH changes, that also changes your microbiota, your biome in your vagina. So you're going to notice that you might have a different smells. That's very common as you get older. So many doctors will recommend Allura, but I think that this new product, Allura, is very expensive. I know that because my sister takes Allura because she also had chronic infections. It's Prevent. So, Natural Approach to Nutrition, the same company that makes Bladder Rest and Bladder Builder and Peora, was asked by the top IC researcher to create an alternative that was affordable for women who got recurring infections, and it is Prevent. And this has now been used for a couple of months out of this major IC research center pretty successfully, and patients are reordering it. So we got our first 24 bottles. I think we're down to 15 now, just like 2 weeks ago. So if you wanted to try this might be viable too. Also, next generation urine testing is important because, listen, you got to track the type of infection. You can't just accept this is true for everybody. Like, seriously, if a doctor says you have infection, your next question is what kind of infection? And they're going to say bladder infection. And you're going to say, no, 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 no. Can you tell me what the bacteria is? Because if it's the same bacteria over and over and over and over, then you've either got a super drug resistant bacteria or you've got something that's inoculating you in your home, like the jets of a hot tub or a jacuzzi or in a bathtub, which are notorious. But if it's different bacteria every time, then that speaks to your immune system. And it may be that your immune system is struggling.
And I've got a family member where we've seen that now, and ultimately, in the end, it all comes back to the health of that immune system, and IgG levels and different immunoglobulin levels to try to make sure that your body is strong enough to be able to fight infection. Carol says, "Where do you get next generation testing?" You can get it anywhere. You basically order the kit, and then you do your urine sample, and you have your doctor sign the form. They are now requiring doctor signatures on all the forms. They changed their website. I haven't changed our website yet. It's on my to-do list. Gwen says, "I had to change my cyst till June. I don't drink any caffeine or soda. I've been trying to do the IC diet. All fruits, eggs, milk, veggie, beans. Trigger, I can't seem to find a doctor to check my sensitivities." Gwen, you could order an ALCAT test, ALCAT, ALCAT test. But again, COVID's messing with everything. And so, getting those appointments, I mean, listen, at that level of sensitivity, if eggs, milk, vegetables, beans bother you, then that really speaks to the health and condition of your bladder wall. And normally, the only time I see that level of diet restriction is if you've got Hunner's lesions that are untreated, or you've got some sort of profound inflammation going on, irritation going on, or there's something you're doing every day which is badly irritating your bladder. But I would suspect Hunner's lesions. I don't know. I mean, and that's where, I mean, that's the thing, is you don't know. I don't know. And your doctor doesn't know. We need eyeballs on the organ. I mean, that's exactly when you want to talk about having more diagnostic testing, and let's make sure they haven't missed something like Hunner's lesions or whatever. What about water filters? You have to be careful with water filters because they often take out the pH balancing minerals. Thus, many water filters, like a Brita water filter, produce acid water, and that's not good. Gwen, how long does it take the PR to start helping with pain now that I have my stimulant? I'm going to go buy the PA in the book. Well, the only thing that's immediate with pain is an opiate because it acts at the spinal cord. Obviously, Pure is not an opiate medication. Nothing is going to be as instantaneous as an opiate medication. Um, I will just say that in my experience, at least dealing with my nerve pain, I really feel a slow but gradual improvement over literally a couple of days. You just have to kind of give it a shot. But what the IC research study said that by month 3, 87% of patients had a significant reduction in their pain, and by 6 months, every patient using it had a significant reduction in their pain, and 25% were pain free. So, using Piora to help reduce pain, it's supported by research. Not this brand. The brand they used was called Umpi. It's available in Europe. It's not available in the US. Um, Piora, it was the attempt to try to match that formula, but actually improve on that formula. And so this is the closest we have to that original formula used in that study. If you're wondering what I'm drinking, this is rooibos tea, pumpkin spice rooibos tea. Not bladder irritating, no caffeine. And you can see the lights keep changing. Lots of clouds, lots of wind. Man, the clouds are moving fast. So if you're wondering all the colors and stuff, that's why. Carol says the virus has caused problems with seeing my doctor because he's only in the office 3 days a week. Now only until noon to 1. I'm afraid to go to the doctor's office with the virus going on. So Carol, I talked about this earlier. Um, um, Really honestly, the doctor's offices are the ones who are taking this the most seriously. So when you go to the office, when you go to the doctor, you're usually met at the door. They take your temperature, they ask about your symptoms. Then you go back and you sit in your car, and then they will text you or call you when you can come in. And they're all wearing masks. They should all have their various PPE on. They're usually only seeing 1 or 2 patients at a time. And there are hot clinics and cold clinics. The hot hospitals, the hot clinics are the ones treating COVID. The cold clinics specifically excluding anybody with respiratory system symptoms. So, Carol, what you can do is call the doctor and just say, "Listen, is anybody with COVID being treated at your facility?" And if the answer is no, and you could say, "Is this a cold facility as compared to a hot facility?" If they say yes, it's a cold facility, then that's good. And what they were doing, at least in New York, so I was reading from the American Urogynecology Society. They were having really good discussion strings on COVID and how it was affecting their patient care. In some cases, they're actually making arrangements to meet at a completely different facility that is completely cold. So if that hospital had worked with COVID patients and you don't want to go there, they're trying to set up care offsite. I have to tell you a funny story. My dad, my 97-year-old dad, like the second week of home quarantine, and I told both my parents, I said, "Listen, we're not going to the doctor for anything minor, period, done over, not going." Because they tend to get a little worked up about stuff, and they call the doctor for very simple things in this case, my dad had stayed up until 2 or 3 in the morning on his computer, and he woke up with sand in his eye at the next morning. And again, he's 97, and so, a little bit of losing a little bit of that reality check. So before I even knew it, he had called urgent care. He called the urgent care center to have them look at his eyes. And I walk into the kitchen that morning, and he hands me the phone and he said, "This is urgent care. I want to go in because I have sand in my eyes." So I talked to her on the phone, and it's like, "Are you screening COVID?" "Yes." "Are you seeing anybody COVID there?" We screen them here and then we send them somewhere else. But yes, we are seeing them here." And I just looked at my dad and I said, "I'm not taking you to urgent care for sand in your eye. You have dry eyes because you worked on the computer till 2 in the morning." And he was quite mad at me. But I just refused. There was one other similar thing, and it's like, "No, we're not going. We'll do a video appointment." Gwen, burning on the vulva entrance. It feels like bladder infection too. I have bladder spasm, started with pelvic rectum issue. Rectal doctor suspects pudendal neuralgia, but they can't see that on MRI. They ruled out a cyst. Okay. You're making progress, hon. This is good. You're ruling stuff out. That's very, very good. So with pudendal neuralgia, you need a proper workup for pelvic floor pudendal neuralgia, and it would be fascinating to do nerve blocks to see if a nerve block would turn off your pain. Gwen, if sitting consistently hurts, the book you got to get, Gwen, seriously. You have got to get this book. This is the master class in the pelvis, and it has not only will it teach you where everything is and what it does, it has a fabulous chapter on pudendal neuralgia and what they do about it. And this is only going to help you work with that doctor better, because you're going to say, "Can I rule out this? Can I rule out this? Can I rule out this?" If you have read this book before you go to the doctor, you're going to be able to take control and really have a good functional discussion, you need to know that the pudendal nerve starts off of the sacrum in 4 sections. Then it combines to create the pudendal nerve. And so any one of those 4 sections, as well as that first structure of the pudendal nerve, can be compressed and injured. Then it goes through something called the Alcax canal, which is controlled by your obturator muscle. That's where your obturator muscle can mess with it. Piriformis muscle can mess with it above the Alcax canal, but if it's in the Alcax canal, that's very correlated with the I think the obturator muscle. And then when it leaves the Alcox canal, it splits into many sections and it innervates the clitoris, controls the nerves around the urethra, the perineum, the vaginal area, the vulva, and the rectum. And so I had last year pins and needles along my outer vulva that I thought was a yeast infection, vulvodynia. To make a long story short, it was pudendal neuralgia from tight muscles, and we wasted 3 to 4 months doing yeast stuff and then doing, steroids. And finally, the pelvic pain specialist went, "Jill, do you realize that this is probably just pudendal neuralgia?" And they did an exam, and yeah, my muscles were really tight, and I wasn't doing my protocol like I should have been. They brought me back over to physical therapy. I took the last one seriously, and I was pain free within a month. But I have to listen to my body, and when it starts getting tight again, and it started getting tight again 2 days ago, and I've got to take it seriously. What about AZO helping with IC Awareness Month? I think I talked to them once a couple of years ago. Let's see. Adele says, I've had IC every day of my life for 53 years. Used to get grounded as a child for wanting to wheeze so much. Always getting shouted at for it and using the loo. I know what makes it worse, but the urgency and frequency is my normal. As soon as I've been something, I get the pain wanting to go again. Diagnosed in my 20s, a coloscopy, 2 urethral stitches, and a bladder wash put me off any more probing, as we would expect. I've lived on hospital strength cocodamol and diazepam ever since. It's now getting worse. I know what I can and can't have. Any other meds that would possibly help? Girl, can I just give you a hug? Adele, oh, hun. Now listen, we have subtypes. And childhood bladder issues are put you in a completely different group because we have to try to understand what was happening with your body when you were a child that this began. Now, this is what we know. Frequency, urgency are controlled by the alpha afferent nerve in your bladder wall, as well as potentially by muscles, but typically the alpha afferent nerve. So, I guess concept number 1 is, could you have been born with, kind of a nerve irregularity or nerve dysfunction affecting that nerve? But the other thing that kind of screams at me with your post is the fact that you were getting shouted at and punished. Um, I have told I mean, I've worked with patients for 27 years. I've worked with many patients whose symptoms began in childhood like yours. And in most of those cases, I will say they were either bedwetters and they were punished for wetting the bed, or they suffered a physical trauma. And so I've told the story of a gentleman that I worked with whose mother forced an enema on him every day before school. And now he's in his 50s and his pelvic floor is locked like concrete. And I think it's a defense mechanism from being forced to have an enema by a mom who didn't have a clue. So imagine the learned pelvic floor tension that that child, is it's just this, it's the same thing of somebody who is repeatedly sexually abused. Your muscles get tighter and tighter and tighter subconsciously. And so we would want to, but then I've also worked with a couple of patients who were hit by cars. One gentleman who was run over by a car, one woman whose pelvis was crushed by a car, where there was a major physical trauma that has led to bladder issues their entire life. Um, and then we also too have to look at environmental issues as a whole, and that is, was there something I worked with? Yeah, one mom and daughter, and the daughter had eosinophilic cystitis. Eosinophilic cystitis means an eosinophil is a white blood cell. It basically means that the bladder wall was just messed up bad with massive white blood cells everywhere, like there was a giant war happening in the bladder wall. And they were able to trace that back to contaminated well water. Um, Unfortunately, there are very few doctors in the world who specialize in kind of this chronic pediatric um, presentation of symptoms. And in fact, hold on a sec. Hold on a sec. So I just got from our warehouse all the old stock of magazines um, to be giving away or sending to doctors. And the one I had the most of is this one. I love this cover. And the lead story is Children in IC, Why Few Pediatric Urologists Treat and Diagnose IC. Is that just not? It's always heartbreaking to work with a young child and their parent who's got symptoms. Um, so there really are very, very, oh, look, it's the same one that did bladder rape by silver nitrate. Same issue, right? And you can see that story there. So, Adele, understand that everything that they did for you back then, we don't do now. We don't do urethral dilations now. They don't do bladder washes anymore. You need a proper diagnostic workup. Specifically, you need a pelvic floor assessment because we now know, again, that traumatic injury can trigger all of this. And if you fell off your bike or your tricycle when you were a kid and damaged a muscle and damaged a nerve, that could explain all of this. And so, it, in my opinion, you know, if I'm in pain, I want somebody to look at me to help me figure it out. I don't like guessing. I don't think guessing is good enough. I think you deserve more than a guess. But it's also absolutely real that you would not want to go back after having I had about 100 urethral dilations when I was in 7th and 8th grade because that's when I first had frequency urgency. And in hindsight now, it's like, holy hell, that had to be pelvic floor tension. It had to be pelvic floor tension. I specifically remember falling on my tailbone right around that time. But we didn't know it back then. We know that now. And so I think and the other thing too is the American Urology Association guidelines for IC absolutely acknowledges the trauma that patients went through 20, 30, 40, 50 years ago and why you would not want to go back. And that's why in the guidelines, they specifically focus on not traumatizing the patient. They understand the harm that was done. They understand why you would not have that trust anymore. But here's the good news. We've learned so much in 50 years. It was 53 years ago. And you were done, and 30 years ago, and 20 years ago. We now know more. I think it would be really interesting. And listen, guys, seriously, what do I say every time? You're the boss. You control everything. You pay them, they don't pay you. You're paying for their expertise. You're not walking in a slave. You're not walking in. I don't want you to walk in and say you've got IC. I want you to walk in and describe your symptoms and say, doctor, I'm trying to understand why I have these symptoms. Can you please help me understand what could be causing this pain on my left side that makes it feel like I'm sitting on a cell phone on vibrate? Or can you help me understand why when I have sex it hurts? Or can you help me understand why I'm so afraid to go to the OBGYN because when they put the speculum in, I scream? Or can you help me understand why I can't sleep through the night? I'm up every 10 minutes. Don't fall down the rabbit hole of saying I see. Your ability to describe your symptoms in depth and walk in and ask for help with those symptoms is everything. But if you walk in without the knowledge, without being able to have a good discussion with them, you're giving your power away. And the best book that will make you a barnstormer in the medical care world is this book, Breaking Through Chronic Pelvic Pain, A Holistic Approach for Relief. This will teach you everything you need to know about the pelvis. So Adele, one of the things, okay, so here's another thing. Okay, wait. Here's another thing that matters. And this is why this book is so freaking good. So when I was in 7th grade and I couldn't sit through class, right? I couldn't sit through class. And the teachers were getting mad at me. I had to pee at least once or twice in any class I went through. So we go to the doctor. He sends me to the urologist. They gave me massive antibiotics. It didn't work. They decided to do an x-ray. I remember I had to take Epsom salts. And oh my God, did I have the runs. Nobody prepared me for that. They didn't tell me what it would do. All I knew was holy hell. The next day, I went into my local urologist's office and had a bunch of tests, one of which was an x-ray. It's like, okay, really great nurse. It was just me and the nurse. Loved her. And she goes, "Hey, Jill, you want to come in and see me do the x-ray?" And I was like, "Yeah, I'd love to see it, to process the x-ray." So she takes me into the little room because this was back in the old days when it wasn't digital. And it slowly appears on the screen and my back is curved. I have an S curve. And I looked at it. She looked at that and looked at me. I looked at that and I looked at her and I went, "Oh my God, I must not have been standing up straight. Let's do it again and I'll stand up as straight as I possibly can. Go back and do the x-ray. I stand up as straight as I can. I'm a good girl." We do it again. X-ray shows scoliosis. I had had a scoliosis test 6 months earlier. It was negative. I had a growth spurt. I was a big girl back then. I mean, I was a chunky little girl with big giant boobs for a 7th grader. That's what the women in my family inherit. I had a growth spurt that manifested as a curve. What does a curve do? A curve makes your legs uneven. So one hip was now higher than the other because of the curve. It's called a mechanical injury. And that's what he talks about in this book. So this is the other thing that could be playing a role in you with your care and with your symptoms. So in patients who, the thing about Dr. Weiss is that he became a master at releasing tight trigger points and calming nerves down. What baffled him is why did it come back in the same location every month or every other month or every other week? And that forced him to study the mechanics of the pelvis. And what are the factors that influence the pelvis? Specifically, your weight. I was a fat little kid. I'm not lying here. And I also had scoliosis. And I was pigeon-toed. I was a little pigeon-toed. My brother was very pigeon-toed and had to wear a big metal brace on those shoes. Mine was to a much lesser extent, but I'm still a little pigeon-toed. Um, and anyway, in this book, he explains how a foot problem, a foot abnormality, if your arch isn't correct, if you've got Morton's toe, Morton's neuroma, if you've got one leg longer than the other, that indeed can cause long-term chronic pelvic floor muscle tension that can then trigger long-term chronic bladder problems. So Adele, girl, you got to buy this book. You have to get it's free. You don't even have to buy it. It's free on Kindle Unlimited. If you want it on Kindle, it's $9. If you can get it in our store for $29, it's $36 on Amazon. I bought 25 of these full price and gave them to everybody. And now I finally got a hold of the doctor, and so I get to buy them in bulk. So that's why they're cheaper. Um, this book is amazing. So I have to wonder if there was anything else going on with you physiologically when you were a child. Were you walking normally? One leg longer than the other? Anything at all like that? So Gwen says, "Can you please recap your pelvic pain?" Yes, I can, absolutely, and I can do it with this book. So, hold on a sec. Let me let me see if I can find a good picture here. So the thing you got to understand about the pelvis is it's the most important part of the human body. It is the hub of the human body. And remember, the biggest bones in your body carry the most weight. Your body is designed that the bigger the bone, the more weight it carries. Thus, your biggest bones are your hip bones. So your hip, and so one of the purposes of the pelvis and your hip bones is to carry the weight of your torso, right? But it also deflects the forces and that get pushed up your body when you walk or jump or stumble. That also gets reflected directly up your legs, directly into your pelvis, right? Um, I want to try to, okay, let's look at this picture for a moment. This is a picture of the hip rotator, specifically the piriformis muscle. So this muscle is attached to your sacrum, and then it goes all the way and attaches to your hip bone. And then also out of your sacrum, you've got nerves going through these holes that then merge into the pudendal nerve. So there's a lot happening in the pelvis. If this hip rotator is messed up, it's going to cause either pain on the left side or pain on the right side. Now, I have SI dysfunction. No, well, number one, I've got scoliosis, so my hips are not level anyway. So my hip rotators are always going to be slightly off. But I also have a little bit of SI dysfunction, which means that the SI joint. Okay, here, hold on. So if you can see, here's your hip bone, and then here is the other bone. I forget the name of that bone. Sacrum? Oh, it's the sacrum. I would think this is the sacrum. Listen, I didn't take anatomy because I didn't want to work on a cadaver, so I apologize for that. Okay. Anyway, this is your SI joint right here. And one of the things that the piriformis muscles do is they stabilize this joint right here. This joint is meant to be firm. It's not meant to flex. It's not meant to flex. It is a firm joint. If it starts to flex, what happens is your piriformis muscle has to compensate to try to hold it together. And that is the epitome of piriformis syndrome or sciatica. And so what happens is your piriformis muscle has to compensate, and it gets tighter and tighter and more dysfunctional, and then it starts squeezing nerves, and then you get sciatica. So I have left side SI dysfunction, and that is why I had pain. Not that you need to see my butt. My pain is right, it's about an inch and a half to 2 inches to the left of my tailbone. And one of the things that they will often have you do is um, use a tennis ball, right? And I will around the sit bone, because most of my pain is around the bone, right in the middle of my butt cheek. And it's amazing how painful that is. So SI dysfunction is real. Piriformis syndrome is real. Karen says, I found having my internal medicine doc do an Accuscope treatment. After 3 sessions, my IC was remission. Accuscope? What is Accuscope? Let me search it. And you guys, again, I'm about 30 minutes behind your questions, real time on Facebook, because you asked so many. And then I go on and on. Accuscope? What is an Accuscope? It's a microscope. What? It's just a microscope. Okay, so you have to explain what that is, hon. I have no idea what that is, what you're referring to. Becky says, I have a paid Zoom account you could host. Awesome. Becky, that would be awesome. Thank you. Hope says, I just had emergency oral surgery with Novocaine. It's been 3 days and I did not flare. I'm crazy diet sensitive, so I wasn't sure, but I was fine. Congratulations, hon. Yeah, mine is healed too. I had to have an emergency oral surgery for right before, like literally 2 or 3 days before the shelter in place, because I had an abscess tooth. Hope says, started reading it, agree, it's a game changer. It is. Obturator, alpha afferent nerve, AFFERENT, alpha afferent nerve. Pat says, my daughter had a bike wreck at the age of 10 and she has had trouble ever since. Can you suggest a doctor in St. Louis, Missouri? Hun, we've got a list on our website. You can just go to the Find a Doctor area of our website, but understand that her case is probably going to be quite complex. And if there's any way you can get either up to see Ken Peters or go see, no, I wouldn't go to Ken Peters right now because COVID is really, really bad up in Michigan. Honestly, maybe Wake Forest in North Carolina, and have a real master, diagnostic master, work, see if they can understand the injury itself and what it did. I think that that would be real. Carol says, I peed the bed until 11. My poor mother had to wash sheets every day. Oh, isn't that interesting? You stopped wetting the bed after you moved in a family friend's house. Do I think wetting the bed has something to do with IC? No. Well, it has something to do with your pelvic floor muscles, hon. Um, but I don't. I mean, I'm not an expert at bedwetting. I wet the bed a couple of times, and I just remember being mortified and getting up and changing my sheets and trying to hide it from my mother. But is it possible that there was some sort of stressor in your home that did that? Sure, I think it's possible. I mean, the fact that you stopped immediately on moving out, I think that that speaks to something. Gwen says, Are you doing another giveaway on the book?" Okay, you guys, the book is on our website. Just go to our website, icnetwork.org, and just click on the shop, and it will take you it's right on the front page of the shop. I was gonna do a different giveaway today, to be quite honest. I only have a couple of those books left. Alright, YouTube, I'm so sorry. I love you, YouTube. Lisa says, "Do you think COVID makes us more susceptible?" I mean, do you think IC makes us more susceptible to COVID? And the answer is no. No, it's not correlated, in that way. The only thing that would potentially make you more at risk is if you're taking cyclosporin, which is an immunosuppressant, but there's no suggestion that having IC, remember, injury or estrogen atrophy would, make you more susceptible. And remember too that they're not finding the COVID in urine, which means it's not necessarily making it to the bladder to do anything anyway. Zana says, "I wonder if eye color has any correlation with IC." I believe that it does, because if you're blue-eyed, that normally means that you are of a Northern European descent, which means potentially that you might have a more sensitive nervous system, right? So, you know what? So, like, hold on a sec, guys. So, look, it's only 3:30. I wonder if I can give me a moment here. 'Hold on a sec. Should we try to do a Zoom meeting right now just for fun? 40-minute limit on group meetings for the free one. How about hazel eye color, fair skin, reddish hair? I think it makes you more susceptible to having a sensitive nervous system. Well, as the German, I'm a little tiny bit German. I'm 95% Swedish and Norwegian myself. All right. So I'm going to set up an account on Zoom. Okay, and for all you experts out there who already have Zoom accounts, hold on. Let's just see if we can do it. All right. So let me just confirm my email here. Zoom, please activate your account. All right, consider it activated. Am I signing up on behalf of a school? No. I'm signing off on behalf of an amazing group of patients who deserve love and compassion and support. Oh, wait, hold on. I have to use a capital letter. Done. All right. Invite your colleagues. Okay, I have to do email addresses. I'm not a robot. Bridge, bridge, bridge. Okay. All right. All right. So for those of you who have Zoom, isn't there a way of giving people a code to enter the meeting um or do I have to email people? I don't know what the meeting ID is. It's saying don't Zoom alone, invite colleagues. Okay, I'm going to press skip this step. Oh, okay. Oh, okay. Now I have a URL. Okay, okay, now hold on. If nothing else, yeah, it's forcing me to download. So here, hold on. All right, it's installing. All right, so in the meantime, while that's installing, we'll try to do Zoom meeting after this. Let me tell you what my giveaway is going to be. Actually, let me go. Hold on. Okay. Oh, wait. Okay, now it's asking me to sign in. What? Incorrect password? Come on. What email address? Okay. Okay, guys. So hold on a sec. So I have got from our warehouse about 20 different issues. I mean, just, like 10 each back issues of our magazine. And what I was going to do is I was going to put together, like, send anybody who wants them 3 or 4 or 5 different issues of our magazine. So you have a whole bunch of magazines to read if you want them. So that's my giveaway. And we don't need to do a contest here. If you would like some of the back issues of the IC Network magazine, the IC Optimist, all you got to do is email me, icnetwork@mac.com, icnetwork@mac.com. And that will, and then I'll just put together a nice packet of info for you. Okay. All right. So I'm trying. I'm trying to get there, I promise. Okay. Oh, there's a personal meeting ID. All right. So personal meeting. So why isn't the app accepting my password? Okay, so I'm going to try this again. Okay, seriously, I'm not going to forget this. Don't use. Better work. No, come on now. All right. Okay. Let's try this again. Okay. New meeting. All right. Join with, hold on. No, I did not hear that. Speak and pause. Do you hear the replay? No, I do not hear the replay. You have 3 microphones. Now testing microphone 3. I do not hear that. Testing 1, 2, 3. Maybe I need to, do I need to have my earbuds in? You guys, I swear we're going to do this. Okay, anybody who wants back issues of the IC Network magazine, I'll send you 3 or 4 or maybe more so that you can have them. You'll get some older ones and some newer ones. I'm pretty damn proud of my magazine anyway. I think that we have a lot of readers around the world. Every issue is a fun issue to do. And this issue, I've got a kick-ass editorial on COVID and how to survive it. Let me tell you. Okay, hold on. Testing 1, 2. How do you, wait. Okay, you guys, I do not hear a replay. Testing 1, 2, 3. I did not hear a replay. Built-in microphone. Testing 1, 2, 3. I got nothing. I hear no replays. All right, so I think I have the code for it. And I'm sorry, I'm all discombobulated here. Okay, I just put the code into Facebook. And YouTube, I'm going to give you. I don't know what I'm doing. I'm sorry. Yeah, I don't have all your email addresses. I know you can, yeah, it's just I can't hear myself. That's a thing. Share screen, join audio. Wait, hold on. I'm using my computer audio. So how do I invite you guys? There's no meeting password. I don't know how to set up a meeting password. What am I doing wrong? Somebody help me. Stream setup. Did you get in? I only see one participant, me. Invite. Copy invite link. Okay, here we go. Okay, Facebook, there's an invitation link. YouTube, there's an invitation link. Did that work? I don't know what I'm doing. I'm sorry. Okay, wait. Lisa, did you just send me a link? Here's the meeting password. Hold on. Okay, so the meeting password is, hold on, 3BXVH6. 3BXVH6. I have got all weird. My hair is not normally like this. Okay, oh wait, we have people. We have people. Okay, so I'm pressing admit, 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 admit. Oh my God. Admit. Oh, look at you guys. Oh, this is so cool. I can see your beautiful faces. Now, can you hear me in the Zoom meeting or not? You can hear me? Yes. Yes, yes. Yes, 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 yes. Oh, look at that. You've got a parrot. You have got a parrot on your shoulder. Hey, Donna. It's so nice to see you. All right. So you guys, now I can't hear you. Are you talking in Zoom? Can you try something or do I have to turn you on? Okay. Can't hear you at all. Shoot. Well, I can see you, but I can't hear you. All right. So I'm going to admit Meg and Carol and iPhone. Oh, just to see your faces? John. Hey, John. Nice to see you. Okay. So hopefully I don't know how. Okay. Now I just lost somebody. Carol. Okay. Now, okay. Did I accidentally mute the audio? No. Okay. I can't hear anybody. That's my problem. And okay. Okay. Let me go to my audio settings. Oh, that's why. I know why I can't hear you. Oh my God. I'm an idiot. Hold on. Hold on. No, see, because I got this fancy microphone. Oh, wait. Yay! Oh, hey. This, Oh my god! Carol! Yay! I don't know. Okay. Yes, everybody gets magazines. Hold on. Shannon. Okay, Shannon, Fiona, you're just in now. Now, Sherry! Th Oh, you're very welcome. Uh, okay, so okay, I will. Okay, so somebody has if you don't have a headset, so guys, if you don't have a headset, we hear everything in the background, including me talking. Oh, okay. So hold on. Let me do that. Hold on one sec. Okay, so give me one sec here. I'm just muting everybody to start with. Okay, so there's just one more person that needs to be muted. Okay, so I've got all of you muted right now, so that's better. Nod your head if that's better. You're not hearing background noise. Is that better? Okay, so let me just unmute you guys one at a time. Okay, so Jonathan, first of all, Jonathan, dude, we have been talking for a couple of years now. It is so great to meet you. And how so you guys, let's just do this. We're just going to go through the room. And you know what I'm going to do is I'm going to you guys, everybody in the regular support group meetings now on Facebook and YouTube, I'm going to shut that down. And hold on, anybody who wants to come in, I'm admitting you right now. Lisa, you just got your invite. Tanya, you just got your invite. Everybody's muted right now but me, but that's okay. Lisa! Oh my god, Lisa! How cool is that? I get to see your faces. I just like want to give you guys all hugs right now. Okay. So everybody else is in. So we've got it looks like we've got 13 people in the thing. So I'm going to shut down the streams for the support group meeting. So you guys, for everybody watching on the support group meeting right now, you've got the links. If you want to come into the Zoom meeting, you're absolutely welcome. We would absolutely love to see you. Big hugs. Send me your email if you want anything, okay? Okay, hold on. I've got people muted here. All right. So YouTube, goodbye. Be well. All right. Face and hold on. So YouTube is shut down.